Welcome. I'm Dr. Vinay Prasad. I'm a hematologist oncologist, and I'm associate professor of medicine at the University of California, San Francisco. In my professional life, I see patients, I teach trainees, and I do research in healthcare policy. This is Plenary Session. Plenary Session is a podcast at the intersection of medicine, oncology, and health policy, and you're listening to Season 3. On this week's episode. This week on Plenary Session, we're taking a departure from oncology. We've got COVID. We've got COVID on schools. We've got COVID and Scott Atlas, and we've got COVID policy broadly. I'm joined by Vladimir Kogan. He's an associate professor at The Ohio State University. I've got Bhattacharya, Stanford University, and I have a dialogue with Dan Morgan about the things Scott Atlas said, whether they're right, wrong, or we just would have said them differently. So you won't want to miss this episode. It's all COVID, no monologue. I got too much for you this week. So buckle up. Here you go. If you like this podcast and want more content, follow me on Twitter at vprasadmdmph. Check out the YouTube channel, Vinay Prasad, MD-MPH. Patreon backers will get access to the slides for lectures I give on Plenary Session. Want to hear from us? Email us your question at plenarysessionpodcast@gmail.com. All right, I'm back here on Zoom, joined by Dr. Vladimir Kogan. Dr. Kogan is Associate Professor of Political Science at The Ohio State University. He's joining us from Columbus, Ohio. He is an expert on many things in political science, but with a particular focus on education, and it's so timely. Dr. Kogan, thank you so much for joining us on Plenary Session.
Hey, thanks for having me on. Big fan of the podcast. That's an honor to be a part of it.
Well, I'm honored to have you as a listener, because you know what? I know you had a chance to pick up the Reversal book a while back, and you're not the typical Reversal reader because you're not in biomedicine. But I really appreciate that you felt like there are some analogies between biomedicine and political science.
Oh yeah, absolutely. So one of the interesting things in the social sciences, we have something called the credibility revolution, where in the last 20 years it's been a focus on really causality and going beyond correlation and making credible inferences. And so that book was exactly on that question, right? Of how do we know whether something really does work? What's the right way to ask that question?
I see.
So I learned a lot from it.
Oh, well, thank you so much. I'm learning a lot about the social sciences every day. And I learned a lot from you from some private discussions that I'm grateful for. And I'm still learning, trying to figure out what you were telling me. But I guess I would say that I think, what's so interesting with social science is we can agree that the stakes are almost tremendous importance. It's literally the fate of nations, the fate of civilizations, the fate of many, many people. The stakes are really high. And so energy we spend trying to do a better job of asking just simple questions like, does doing X actually do what we think? That's good energy, right?
Absolutely, yeah. Absolutely.
So, I wonder if you might tell us a little bit about, I don't know, maybe just broadly, what is your sort of, your topic du jour is education, and you were mentioning to me how voting affects educational outcomes. I wonder if you might talk about that a little bit before we talk about COVID.
Sure, yeah. So we have in the United States, we have kind of an unusual education system when you look internationally. So we have an incredibly decentralized system, right? So we have over 10,000 school boards that really make key decisions that affect students every day. They decide what the curriculum is. They decide what content standards are. They decide what it takes to graduate. And those are locally elected boards. And so one of the things that me and my co-authors, I think, realized is you can't understand student outcomes. You can't understand educational policy without understanding that local political process that determines who makes that policy, right? These are locally elected school boards. And so we got interested in understanding ultimately how do the decisions that voters make on election day, whether it's electing a school board or passing a school tax or a school bond, how does that actually affect students in the classroom?
Now, I'm kind of dumb, but on the question of school boards, are they partisan in the traditional way we think of partisanship? Are they Democratic and Republican school boards, or is there more sort of complexity and variation in the sort of the philosophies of school boards?
Yeah, it's a great question. So it depends on the state. So some states actually have partisan labels on the ballot.
Wow,
when you go
really?
vote.
Yeah.
So that's the exception. Yeah, most states there are nonpartisan elections, but the people who run for those offices are partisans. And so I think what makes school boards unique is that it's seen as a stepping stone. So if you want to run for the state house, you're going to start off on city council or a school board.
I see.
And so you tend to get kind of, I guess I'll say political hacks in training who want to run for higher office. And so that's their stepping stone. And so a lot of the partisan interests are involved in these elections and recruiting candidates and fundraising for candidates, and putting together slates with other offices. So partisanship, even in what are nominally nonpartisan races, partisanship seeps in.
That's important to know. And then I guess my next sort of fundamental question would be, do school boards have a lot of latitude in setting educational policy, or are there like state level rules like you got to do X, Y, and Z, and those really kind of steer the ship? Or do these people really steer the ship?
Yeah, so it's a great question. And again, I think what makes it complex is the answer is, again, it depends on the state. So the states provide some framework. So you're in California, for example. And so in California, school boards get to pick the textbooks, but it's going to be from a list that the state provides, right? So the states often provide some constraints. The states often determine what the graduation standards are, but there's still tremendous discretion. I'll give you, I think, 3 areas where there's the most discretion.
Yes.
So there's been a lot of interest, I think, in disciplinary policy, right? And racial disparities and discipline. Well, that's set at the local level, right?
It is.
How schools treat students and misbehaviors, that's a local policy. There's policy decisions related to transportation and things like that. I think the one big one is, the number one function of local school boards is to negotiate contracts with their employees, covering things like compensation, but also covering things like how teachers are allocated, making sure that there's equity, making sure that, that the people teaching in the schools have the right credentials. That is fundamentally a local decision, right? How that's done. And so I think that's the area where school boards really have the most influence, is negotiating the terms of employment with school employees.
And that's important because there is a large and rather convincing body of literature that choice of teacher does matter, even if that teacher is as removed from the child's outcomes as the kindergarten teacher. Is that fair to say?
Yeah. So I guess I'll put it 2 ways. I think one, we know that much of what affects student outcomes is really determined outside of the classroom. It's parents, things like that.
Okay.
But of the things that schools have control over, of the in-class environments, teachers by far the biggest and most important. And so, if you take a really disadvantaged kid and you give them one of the best teachers, and you have them get the best teacher for 8 years, you can close much of the achievement gap. So teachers are incredibly important. And unfortunately, in this country, we also have huge disparities, even within school districts across buildings, in the quality and the experience levels of teachers.
I see. And we also have, I think a rich debate that I don't have all the answers on because I'm an empiricist and I'm not a politician. And there's a rich debate on whether or not unions empower students and teachers, or whether or not unions prevent innovation and prevent us from pulling bad teachers. Any thoughts on that in a nutshell for those of us who don't know too much?
That's a controversial question.
Okay.
So, so I think, there's trade-offs. I would say, I think there's trade-offs. I think we have evidence, on the margin that unions advocate for some things that are good for students, but then unions also advocate for some things that are often not good for students, right? They're there to represent the interests of teachers. And so I think it depends on the extent to which, on a particular issue, the interests of the teachers as a whole and the students align. And I think that's an issue by issue thing. I think COVID and school reopenings is a great example where maybe the interests of the students and the adults are not aligned. Yeah, so I'm sure we'll get to that.
That's the main course. But I'm glad you allude to that. And I guess the last thing I wanted to ask you, I think about background is, so the paper by Raj Chetty that I think you and I once corresponded on is a paper that links kindergarten teacher choice to child career earnings, really. You're nodding.
Yeah. Yep, absolutely. So Raj Chetty's done a couple of work. So he has that paper on kindergarten teachers, and they look at kindergarten because there was actually a nice randomized experiment. But they've done some other observational work leveraging other kind of causal designs, not quite as strong as randomized experiments, but also showing that teachers later in life as well affect, but not just earnings, but things like probability of going to college, probability of being in the workforce, probability of having kids, before a certain age. So teachers have tremendous consequences, and we have, other research. So there's some great work on using randomized lotteries to charter schools. And so there's one in particular by two economists looking at the Harlem Children's Zone. And so if you win the lottery to go to a high quality charter school, you not only do better academically, you not only do better in the labor market, but you're much less likely to be a teen mom, much less likely to be involved in the criminal justice system. So what happens in the classroom really affects a tremendous number of these downstream later life outcomes.
And it has not been, I guess maybe it has been, but there is certainly reason to believe that what happens in the classroom, you've alluded to some things that one would think would not be linked to the classroom, being a teen mom, being involved with the criminal justice system. One, socioeconomics is linked to the classroom. And insofar as socioeconomics is a major driver, there's another Chetty paper I think about, which is someone's income percentile and wealth percentile and longevity. And there is a huge gap in this country that people who are wealthier live, I think it was a JAMA paper, I think it's about 20 years longer than people who are poorer. I wonder if you talk about that for a second. When you think about education, do you think about longevity? Is that tied to education?
Yeah, well, so I think of it. Yes, I think of it in a slightly different way. So I think the work by Ross Chetty is incredibly important. And one of the things they identify as a determinant of longevity and all these other things is neighborhood effects, right? That where you live affects all these outcomes.
Yes.
And so we want to think about what is it about the neighborhood? And the neighborhood is a bundle of things.
Yes.
Part of that is safety and public safety. Part of it is housing stock quality, but part of it is also education. So in this country, in some ways we have a crazy system where your address dictates which school you're assigned to. And so I think education contributes to these relationships. And I mean, I'm not going to say it's probably the main one for longevity. I'm sure public safety and things like that matter more, but it's certainly, I think, part of that equation.
Yes. Okay. And I guess I would say that, I echo that. And I think to some degree, the ability to move yourself from one sort of wealth and income bracket to another bracket is a good harbinger, I think, of improved health outcomes because of all the sort of challenges that are faced in this system for people in the poorer income brackets. And so you're not a child psychologist, but the other sort of, we're talking a lot about the sort of the practical way in which education policy decisions affect the lives of children. But there is also an emotional development side of it as well. I don't know if you'll feel comfortable speaking about that, but it is important that kids at some age interact with other kids of some age to learn social norms, to have normal social development. There's questions of whether or not if they miss out on some of those in-person interactions, there's increased anxiety or suicidality or things like that. I wonder, do you feel comfortable talking about that, or do you feel like that's a little one step removed from what your interest is?
Yeah, I mean, I would say I'm probably not the expert. That's one step removed. But I think in that, I would say in the same bucket, I think the out of home interactions are really important. Part of it is because of the peer effects. We know peer effects are really valuable, but also part of it is interacting with adults. So I think one of the tragic things we've seen during the current COVID crisis is a huge decrease in reports of child abuse, and that's because that often gets caught in school, right?
Yes.
So I think when we're thinking about overall well-being of children, right, schools are important not just for the learning, not just for the interactions with students, but it's actually with adults. In many lower income districts, that's also where students get their meals on the most consistent basis, right? So if you're not in school, you're not really eating, or maybe not eating as well, not as consistently. So I think that's all part of this experience. And I think it's really important to keep all of that in mind.
Before I came on to talk with you, I've been spending the last couple of weeks reading about education. You might notice because I've been tweeting about it a little bit. And I guess, I don't want to pretend like I know all the answers. I don't know all the answers. But what I do worry about is we've reached a place, particularly in the online forums, where we can't really have the debate. And by that I mean, I think there are very well-intentioned people whose background is infectious disease, and they look up at the scoreboard, and every case of COVID is a stab in their heart. And they want to keep that number, the scoreboard, COVID cases, as low as possible. And if that were your sole goal in life, you would put everyone in their own individual room. You wouldn't even, and you just lock all the doors, and you do it for 21 days, and COVID gone. Bye COVID. But we can't do that with people. People are gonna bend the rules and all these things. And so people with that kind of philosophy, keeping the total COVID count low, it is natural that they would want to not have school. I mean, so I see that, and that's fine for them to have that perspective. But of course, there are trade-offs, and they talk about the trade-offs as if it's health versus education. But what I think that misses is that it's health versus health, because education is a prerequisite for health. And I guess my philosophy here is I just want to be able to break something so that we can actually start talking about this more balanced. And so that's, I just a prelude. But one thing I did before I entered this discussion is I wanted to spend some time just to understand the lay of the land. I read so much about schools being closed. And then I started to do some surveying and some reading. And then somebody sent me a tracker called a school closure tracker. And I found some things that were really surprising to me. I don't know if you'll agree with these, and then I'll give you a question. The one thing I found that was surprising to me was that daycares, especially for-profit daycares, are really running full steam ahead. And to some degree they have to, because if the parent's a nurse or a doctor, or, what the hell you want, so the parent's got to put the kid somewhere to go care for other people. Or the parent works in, Target or works in the grocery store. I mean, there are people who do that and they need someplace to put the kid. Otherwise they're unemployed as well. So I noticed that, private schools that people pay for in private daycares, those are high rates of still going. And then I saw this map of public schools and it blew me away. It was like the Electoral College map. It was like all the red states were like 90% plus in-person school, and all the blue states were like all Zoom. And then we've of course seen the picture of those poor kids in a parking lot using the Taco Bell Wi-Fi to do the Zoom thing. And, anyway, I don't want to go on and on, but I'm fairly confident that if you take a young child and put him in front of Zoom, it's not the same as being in a classroom. Okay, so I guess my question to you is, how do you think about the decisions being made? It is a decentralized decision. What are the things that worry you? What are the things you like? What are the thoughts that come to your mind when you take this look at the landscape and ask yourself, what are we doing here?
Yeah, it's a great question. And I guess in the interest of transparency, let me just tell you, I was in my community, one of the earliest proponents of closing schools in the spring.
I see.
And I really kind of beat up the school board saying, what are you guys doing? Because at the time, right, we had shortages of PPE, we had this risk of emergency rooms overflowing and bed space overflowing. So I think we have to remember that was the original motivation for closing schools, to buy us time to get ready. Right. I think the objective was never, we have to close schools to keep people from getting sick.
Yes, that was not the objective.
People are going to get sick, right? So once we bought the time, once we got the PPE, once we got more capacity, then I think it's a different conversation. And it's the conversation you mentioned about trade-offs and risks. And so let me approach it from three different ways that all speak to your question. Okay. And so this can be kind of a long answer. I apologize. But I think one is I want to acknowledge that reasonable people could disagree about risk, right? That I'm not like the moral compass where I can say, here's where we should accept an extra case of COVID. But I think we have to acknowledge that there's should be some logic there. So for example, if you are a person that has a really low risk threshold or very high risk threshold, I think we should all agree that if bars are open, if gyms are open, right, then school should be open, right? That you can't believe it's too risky for school to be open, but not for the other stuff. So I think there's just a lot of irrationality in the priorities that we've made as a society, right?
Yes.
I think people should say schools should be some of the last things to close. And
it should be like hospitals, getting food, and schools. That's like 1, 2, 3. Yeah. And at the bottom are strip clubs, bars, but strip clubs are open. I was reading some article about strip clubs being open. Yeah. I mean, we have to have some sense of, NFL is on the bottom, schools is on the top. Let's agree. That exactly. Any sensible person would say that. So I think that's our first indication that somehow our analysis of risk got screwed up, right? Yes. That we opened all this stuff, and we're not really that concerned about it, but somehow schools are different. So what makes school different? So I think the other thing we have to think about in terms of risk is you mentioned the later life outcomes, and I think you're absolutely right. We know social determinants of health, really important. Social determinants of health are determined by education in large part, right? Yes.
But I think we also have to think about the short-term risk, right? If schools are closed, well, what's the counterfactual? If parents are putting their kids into daycare, it's not obvious we've prevented COVID. We've just infected daycare workers who get paid a lot less and probably don't have paid sick leave versus teachers. If kids are home with grandparents, now we're putting the grandparents at risk.
Yes.
Or if parents are having to take time off from work. So one of the things I read today, which was I think very concerning, is COVID has had a big impact on female labor force participation because of access to childcare.
Yes.
Right. So there's going to be these gender effects that are going to be really devastating for many families. So there's these immediate trade-offs that we're not really acknowledging. That closing schools doesn't mean we're really preventing COVID. It could be that we're just putting other people at risk, and we have to be think carefully about what's going on. So, I'm in my community, our crime rates are at historic highs. We have huge gun violence problems, and a significant number of that is teens. It's teen gun violence. And again, I'm not, I don't think if schools are open, that would go away, but I think not being at school puts kids at a bigger risk, especially if their parents are at work, of going out and doing that.
Yes.
So I think that's the other side of it.
Yes.
So to your question, why are we making these decisions in a crazy way? And I think you've talked a lot about this on the podcast. I think politics, right?
Yes.
I think one of the worst things that Donald Trump did for getting schools reopened is come out and said, let's reopen schools.
Exactly.
Because he turned it into a political issue. Yeah. If he just kept his pie hole shut, then we could have, made these decisions much more rationally than we have.
Because I think a lot of people their decision is whatever he says is the wrong thing, so he'll do the opposite. You're right. When he talks about hydroxychloroquine, you're right. Every time he talks about something, people are gonna have some draw to the opposite. Yeah. So you're saying he politicized it. He should have kept quiet, which he should have.
Yeah. And again, I think this, we've seen this happen with President Obama. When President Obama came out in favor of Common Core, and suddenly America divided, right?
Yes.
All the Republicans thought Common Core was evil, and all the Democrats thought it was great. So I think it's, just a symptom of
where we are as a country.
Society.
Yeah, sure. One of the I think you outlined the first two reasons, right? Which is one, this is irrational prioritization. Two is that it may not actually be doing what you think you're doing. There's unanticipated effects. The biggest unanticipated effect I would imagine is, if you're in a two-person household with kids, relying on school as a form of childcare, either that means your child is left alone, who knows what the hell they're doing. It means you're dragging in grandma, grandpa to be a part of that, which is potentially an inoculum to the parent. The third reason, I don't know if you said it clearly, maybe I missed the three. What's the third? Or I have a third.
Well, I think the third is the politics.
Oh, the politics. The politicization of it.
But I think also think about the long-term risk, right? This is all just, the first two were just the immediate harms now, but what are the long-term effects for these kids, and what's the incidence, right? What's the distributional consequences? Because not everybody is going to pay those costs equally. So, we live in an urban district, but there's a lot of inequality. And so there was a parent that reached out to us and said, hey, I want to start a pod. Let's all pull together and hire a teacher. We can do that.
Yes.
Many of the other kids in my kids' schools can't do that, right? So when we're thinking about the long-term inequalities that are going to emerge, and the downstream consequences, I think it just kind of breaks my heart even thinking about it.
I agree wholeheartedly, and I think it is wrong to even say the policy debate is school closure, because school closure is not on the table. Rich people are going to be sending their kids someplace, whether you like it or not. A rich person would pay whatever it takes to get his or her kid into some place where they can do better for themselves. That's what's going to happen. And in fact, that's what is happening, because I surveyed a lot of doctors. Every doctor I know, they're like, well, it sucks that schools are closed, but it doesn't suck for me because all my kids are in private school. That's what so many people told me. And so that's one. It's not school closure. It's school closure for some kids. And those kids are public school kids in liberal states. It's not public school kids in conservative states, because they're also saying to hell with it. Masks are bullshit and COVID's bullshit and the school, keep it going. It's public school kids in liberal cities and liberal states. It's a strange policy decision we're making. That's the question. Do we join everyone else, or do we, do something different? From a medical standpoint, one of the things that strikes me is the evidence that whether or not children, particularly those under the age of 16 or 18, what is the rate with which they're actually getting infected? What is the rate with which they spread it to each other? There are some ongoing studies of genotyping where there have been school reopenings and people have developed COVID. One theory is, of course, the kids are spreading amongst themselves. The other theory is, of course, the teacher brought it in and spread it to others. There's some evidence to suggest that might be more plausible, but we will know for sure when we do genotyping. So I guess just from a medical standpoint, I'm not entirely convinced that of all the ways in which contagion occurs, from what we know about COVID, which is sort of most people don't spread it and a few people spread it a lot, I'm not necessarily convinced that the school is a big delta in the total sort of infection burden. Just from a medical standpoint, I think there's a lot more uncertainty there. And so what you have is a lot of certainty that keeping these kids out of school is going to do some damage, and a lot of uncertainty about the safety. And I think that's part of it. The other part that I think is hard to put a finger on is the culture that we're in now. I think many of us lament where we were as, when I grew up, my parents would say, go to the store and all these things. We're in a culture that's now where people are very guarding their children, even though it's one of the more safer times for children in America. The idea of safetyism, that, we're sort of obsessed about safety. We're obsessed about our child's safety. I've seen some polls say that some people say that they're not going to send their kids to school no matter what because they're scared about their kids' health. The reality is that this virus, for all all its horrible faults, thank God it doesn't kill kids in higher numbers. It has a very low, it's almost taboo to even say it, but it has a very low infection fatality rate in children. It's not going to kill the kids. In fact, there are people who have done it and they have been criticized for doing it, but there's a certain risk from putting a kid in a car seat and driving. And that risk might be greater from driving than it is from the infection itself on a sort of a broad level. I say these things just to kind of put it in perspective that the safety side of the equation is also not as certain. You alluded to that because there are these countervailing things people might do, like putting a kid with grandma, but it's also the simple fact that we don't really know how much of the virus is driven by young children put together. And there have been some studies suggesting that very little of the spread has occurred that way. But I wonder if we might go to the next thing I wanted to ask you about, which is, you're a political scientist. You're somebody who thinks about these things. I guess I kind of want to ask you, how do you think about these things? Like when you sit down and thinking about policy and politics, like how do you decide what you ought to weigh, whose input you ought to take in? How do you think about things broadly like that? What is your philosophy of it?
Yeah, so it's a good question. So, I'm an empirical political scientist, so I don't spend a lot of time thinking about how should the world be. I spend more time thinking about how is the world. And so, I think this is related to your point. The risks for kids, I think we know are certainly pretty low. There's debate about how much they can spread to family members. I mean, I think we had, so I think some high profile examples like summer camps in Georgia, but we also have many countries that have open schools.
Yeah, and nothing happened, right? Yeah.
But the flip side of that is we have an aging teacher workforce.
Yes. Okay.
And we have a lot of teachers who are older and high risk. And so I think COVID really illustrates what is an issue that I've been spent years thinking about and arguing about and trying to make people care about, which is we have to be careful that we don't prioritize adult interests over kid interests. And I think one of the challenges as a political scientist, we believe voting works. We think, we believe something called the median voter theorem, that elected officials want to get reelected and that causes them to be good representatives. I think that works in general. We can debate how well that works in general. But I think education is a unique context because kids don't vote.
Yeah.
Kids don't vote, right? So the incentives are totally misaligned when we think about what is it, how we make policy if the interests of the kids really are not getting their full weight and the interests of adults really kind of dominate. And so some of our work really is trying to quantify this. And one of the things that I found pretty striking is we have access to really good data on voters. And it turns out that voters who vote in school board elections, who elect these people, who make decisions like will our school reopen or not, they look nothing like the kids. Most of them don't have kids. First
really?
Of all. And they look nothing like the kids. So if you look at the average district, that is a majority minority district.
Yes.
The electorate is overwhelmingly white. And so I think that's, as a political scientist, that's the challenge, right? We want policy that takes the risks into account, but also thinks about the trade-offs and thinks about what's good for the kids. But we haven't set up a system to do that, because our political system does not incentivize that because, again, kids don't vote.
That's such an important point, and it's really such a terrific point, particularly in this context. One of the things I always point out is, we're paying for these costly cancer drugs. We're dropping $250,000 of Medicare money, taxpayer money, to maybe give somebody a drug that adds a week of life and sometimes maybe 0 days of life, But one of the reasons why the powers reinforce that is that those people who may potentially be eligible for the drug, they're voting. They're perhaps even driving elections. Meanwhile, you take that much money, the amount of money we're spending on useless cancer drugs, and you put it in education, the number of life years you're going to add back to society, the productivity, the transformation you'll do in outcomes, alleviating injustice and poverty and suffering and racial problems. So I think it's easy to talk about medicine and how much GDP we're swallowing. I always like to remind, and then people say, well, what else would you use it for? I always remind people that there are all these other things that society does. How we educate and clothe and feed the youngest among us. And those pay dividends for society. And many of us, particularly those of us, I think, who are left-leaning thinkers, we think that we ought to spend more there. The irony of this whole situation is it's some of the leftist-leaning thinkers, the ones most I think, with their finger on the pulse of racial injustice, who are engaging, unbeknownst to themselves, in policies that are promoting racial injustice. I wonder if you might talk about that for a minute. You shared with me a very interesting article that pointed out to sort of what you're saying, that the school districts that are opening are places where parents are pushing to open, and the school districts that are closing are places where parents aren't pushing as much, and that there is racial and economic injustice in those choices.
Yeah, absolutely. And just to give you some context, I think you make just a fantastic point about thinking what's the cost for society. So there's an economist named Eric Hanushek at Stanford, and so he's recently estimated if we just add up the learning losses up until now, just from the spring up until now. So his estimate is in present dollars. That's $14.2 trillion in education losses for the economy.
Wow. Okay.
Yes, from the learning losses alone, $14.2 trillion. So the impact, I think you're absolutely right. The long-term impact is huge. So to your point, we are seeing big differences. There's a survey, the Associated Press and some other groups did a surveys of school district reopenings. And one of the striking things was that, districts where the majority of students are white are 3 times more likely to be open for at least some in-person learning than school districts where most of the students are students of color. And so I think part of that, again, reflects differences in COVID prevalence rates and the risks of reopening schools, but part of it does reflect these power imbalances, right? Here in Columbus, we had a suburb where parents just packed the school board meetings and were demanding in-person learning.
Right.
Whereas I think, in more disadvantaged districts, parents are busy, they're working, they might not know when the school board meetings are, and they might not have the resources to do that. And so I think you don't get the same kind of advocacy on the behalf of students. And there's also districts where you get, I think in general, stronger advocacy on behalf of school employees who quite naturally, care about themselves. So, I'm teaching in class now. I can tell you I was pretty anxious a couple of weeks getting ready for that. So I totally understand where teachers are coming from. But again, I think this is a case where we have to balance those risks, and we have to make sure that we're doing what's good, not just for the teachers, but for the kids, and making trade-offs on that margin where necessary. I
think that's the key, that as you allude to, that there will be trade-offs in all these dimensions. There are things we can do to mitigate the trade-offs. For instance, if somebody is 60 years old, they don't have to work. 50-year-old teachers, maybe they don't have to work. We can pass the baton a little bit to some of the younger teachers who can do more of the in-person education. People who, I hear a lot about people talk about people who are immunocompromised or comorbidities. We know that some of those things are actually pertinent to COVID, but perhaps some of the more traditional ways in which people are immunocompromised do not appear to be incredibly pertinent. But whatever it is, we can think of people who are at higher risk of COVID death and COVID hospitalization and give them a pass, give them a freebie. But for the rest of us, we can still kind of do the best to mitigate and to continue to have school because of the tremendous importance it provides to children. One thing that I think is along these lines, that I wanted to make this point, is that some places that are attempting to do this, they keep a tally of the number of new cases. And as that clock goes up to a certain point, they say, oh shit, there's too many new cases, we got to close it. To me, that's the wrong that's the wrong stopping boundary. You shouldn't just look at cases because it matters to whom the cases are occurring in. You should look at hospitalizations. If the hospitalization gets to maybe a much lower number, but hospitalization, like these people are sick, then stop. But cases themselves, if a child is getting a case and it's asymptomatic or mildly symptomatic, they feel better in a few days. We know household transmission rates might be as low as 1 in 3, maybe even lower if it's children. We don't, these numbers are still in flux. Maybe that's not the end of the world. Maybe it's okay to have a few more cases because those aren't the bad cases. We got to protect the bad cases. You're nodding, but I guess that's more of the medical sort of side of things. But it's something that I see that frustrates me is people say, we tried, there are too many cases. I said, get the damn swab out of the kid's nose and there won't be so many cases. The kid's fine,
That's a very Trumpian perspective, right? We're testing too much. But yeah, I think you're right. And I think you identify what's so difficult. I think people look at COVID case counts as like the policy objective to minimizing that. But that's not the policy objective. The policy objective is like minimizing harm.
Yes, that's right.
And not all cases are created equal. So I think you're exactly right that, there is a little bit of a, perception problem, right? It's scary. It's scary when the cases start going up. And I think we get distracted from really making these rational decisions carefully.
Yeah, and about the Trump point, I mean, Trump is a broken watch. Twice a day he's right, but that's the problem with Trump is that, just because he says it doesn't mean he's wrong. But I mean, yes, of course, when the CDC put out that stupid thing that said, we shouldn't be testing for asymptomatic people, that's not the right answer because potentially we could advise them to stay in and it might make some difference on the margin. But, whether and how aggressively to test people who are at ultra low risk when you reinstate some of these programs that have alternative benefits, there I think there can be some room for debate, even if the broken watch happened to say it. I want to be very careful how I put this. I'm reading a lot of books about Europe recently in the 1920s. And Europe in the 1920s was in a rough place. They had just come out of World War I. And there were a number of places in which people didn't feel the bounce back, the economic bounce back. They felt that there was a growing divide between the rich and the poor. They felt that if you were poor, you didn't have upward mobility. It was a tumultuous time. And one of the points that many of these historians make in these books is that the conditions are ripe for two sorts of things. One, there can be a charismatic person with a progressive vision that takes that energy and tries to use it for good, creating Social Security, creating Medicare, trying to do something that empowers us all, and that 60 years later, it's unthinkable on either political party to take it away. It can be used for good, but it can also be used for evil by despots, by tyrants, by people who point the finger at others who don't look like us, who don't speak like us, who harness xenophobia, who use it to foment bad things. And I guess what really worries me about all the things, in addition to the things you've talked about, is this ineffable thing, which is you take people out of school, you start to put people at home, you make people quit their jobs, you put this people in a pressure cooker financially and mentally because people want to work, they want to be productive members of society. You do these things and you sow the seeds for somebody, not like Trump, somebody who's actually smart, who's actually who has some of the things that give him a flavor of charisma. I mean, I don't want to say that he's got nothing that's interesting. I mean, sometimes you watch him the way you watch a car accident. He's captivating in a way. But there's somebody along there who's got really bad ideas and they hold it together better and they're more consistent. They don't say stupid things. And that person so easily could take his followers and a few more and pick up a few more and take control. I mean, so that's something that I wonder if you might speak to as a political scientist. Am I crazy? Is the stage set for these sorts of things?
Gosh, if you had asked me 4 years ago, I would have said you're totally crazy. Right. But I think what we've seen happen in the world, I mean, it's getting a little scary. I think you're right to be worried about those things. I don't know how much kind of school closures contribute. I think that we have so many other issues in our society.
Right.
But I think one thing that's relevant is education, public education has a huge role as a process of political socialization, right? It's teaching us citizenship skills, teaching us critical thinking. And so I think you're worried about the kind of shorter to medium term. I think we should also be thinking about, what happens to these kids when they grow up, right?
I see.
I mean, especially homeschooling could be great on many dimensions, but it may not be great in exposing you to other people with different ideas, and really building this political community. And so I think, if we look back to the 1800s, right, education was closely tied, and public education was closely tied to this idea of we have to do this to strengthen our democracy, to make sure that our democracy can succeed. And so I think, closed schools now will potentially, I think, make some of these dynamics worse as people are insulated, as their kids are insulated.
That's a fascinating point. Sometimes I see policies that some people champion, like, I don't know, abstinence-only education. And I look at the data and I'm like, oh, that clearly is expensive and takes time and absolutely doesn't change the thing you think it changes. In fact, maybe it even backfires, right? And so I think to myself, the only person who would continue to champion this is someone who was never educated that things don't always go the way you want. And when you do something and you keep swinging for the nail and hitting your thumb instead, you got to stop swinging. And that's part of that is education. So I guess, one of the things to kind of echo what you're saying is it makes you worried that education is also a way in which you can tell political bullshit from the truth, have your own compass, make sense of claims that are told to you. And the more you deprive some of that, you create a citizenship that may not have the tools to make better political choices for themselves, things that actually do work and help their own interests.
Yeah, that's exactly right. I think it's one thing to teach people facts and get them to memorize equations. And I think parents can do that. Online programs can do that. But that's only a small subset of the skills we want schools to develop, right? And I think it's these critical thinking skills that you're talking about, that where that in-person component and that in-person interaction is really most essential, because you need that pushback, you need that interaction with other people, those debates, those arguments, that, I think that's definitely, I think that's an essential part of the education process, definitely for democracy. And I think that's the part that's we're kind of giving up right now in our current educational system as we adapt to COVID.
That's so well said. I like you a lot because you also talk fast like me. And so, I feel like we've covered so much ground in such a short period of time. Is there anything that I didn't ask you that you think is really pertinent? I think you've hit so many points so eloquently that I've struggled to kind of articulate, but are the things that I've kind of taken in. I will be honest with you. 4 weeks ago, I tweeted something like, I don't know the answer to school closure. I'm surprised how many people are so ardent about it. And I said, but here are the questions I want to know. Like, one, what's the delta for the infection if you open versus not open? Two, what's the delta for outcomes if you open versus not open? And I made a list of like 7 things for the kids' outcomes, teacher outcomes, society outcomes, infection outcomes, open, not open. And I started to investigate these things in my leisure time, reading all these preprints and boring articles. And the more I investigated, I was like, it's hard for me to see. I'm tipping that this is really important to schools. And the reasons you're giving for not doing it are kind of boogeymen. They are scary, but there's not a lot of truth. There's not a lot of merit that those things might materialize. And then I started to see this sort of, as you point out, casinos are opening. You can cash your chips in, but you can't, learn to read. I started to see these kind of incongruities, and I became kind of frustrated. And I also felt like we couldn't even have a discussion on Twitter because every time I say anything, they mob me. So I'm wondering, is there anything that I'm missing? You've outlined sort of the pillars that you think are sort of key here, but anything we didn't talk about?
Yeah, well, so let me just add 2 things. So you were talking about reading about Europe in the early part of the 20th century. So there was a great Washington Post article just a few weeks ago on outdoor schooling in the early 20th century. In response to tuberculosis, right? We had tuberculosis outbreaks. We had widespread tuberculosis, and we adapted and we figured out how to let schools continue, right? So in the spring, we were talking a lot about the flu epidemic of 1918 when the schools closed, but we had tuberculosis for decades and we made it work. So I think we can learn a lot from that and realize that, I think in many ways, tuberculosis is really, really scary, right? At least as scary, if not as COVID.
Certainly back then when there was no treatments, and right.
Exactly, yeah.
Die of the consumption.
And so, I think for me, that's a reminder that, hey, like, life does not have to stop. We just have to, work through it and figure out how to do it. And I think the point I want to emphasize is, I think it's great to have all these arguments about school closure. I think, it's ultimately not going to change. So I think we should be thinking about, what do we do to make up for these losses once we're back to normal? And I think it's going to require really expensive investments, but also really politically difficult investments, because I think there's unless we're willing to write off an entire generation of disadvantaged kids, we're going to have to do something about it, and it's going to mean extending the school day. It's going to mean extending the school year. And it's going to mean really high intensity tutoring. And I think it's going to mean all of those. And not only is that expensive, but I think it's going to be difficult because, teachers like teaching because they like the 180-day school year. And so even locally, when I suggested, hey, when school reopens, why don't we just cancel the summer break? Yeah, I guess a lot of pushback, but those are the kinds of conversations we need to have now so that we are, planning for how we're going to kind of make up this lost ground. Because again, I think we can't just say, it is what it is, COVID was bad, let's focus on the kids, and the next group of kids, right? Because this is just going to have such a long-term impact unless we're able to reverse some of the challenges that we've gone through. And that's going to be really difficult. So I hope people are having that conversation and thinking about that and thinking about those trade-offs.
That's an excellent point. I'm still hopeful. It's still September. New York, I think, is slated to go September 27th, they have, infection rates, test positivity rates less than 1%. They were pushed back by unions, by parents, by all these forces, the forces of fear. But the forces that don't like to say the word trade-off, but there were trade-offs. They've been pushed back. So I'm hopeful that we can still turn it around in the fall, that there'll be some places that open more, that people recognize that, I like to keep reframing it as the choice isn't open or close schools. A lot of schools are going to run no matter what. That's where the doctors are sending their kids. And then these other schools, the question is, you want them too, or you want to close those ones selectively? Because that's the real choice. So I'm hoping we can fix it. But your point is so good. Fix it, don't fix it. Maybe it's a good opportunity to do these long-standing reforms. I don't know many kids these days who do summer agricultural activities and need those 3 months off. They need to go to year-round school. They need to have a school days should be work days. This is a foolishness. I don't know why this persists. The school day, the adult work day should be within the school day so they can drop off, then go to work, and then come pick up. That's how any sensible world would work. And the nutrition, we didn't talk too much about, but I've been reading a lot about sort of European standards for nutrition. They serve them real food, man. They serve them good stuff. I want to go eat there. And these are, kids who those decisions and how they teach them to eat in some countries. It's not just the food they eat. They teach them how to think about meals and plan meals and eat healthy as part of a healthy and rich life. That helps them be healthy as adults, I would imagine, and is certainly a worthwhile investment just, for the way you'd want to treat children. So I think it is an opportunity, and I think you're right that it's going to take money, which there's a lot of in healthcare. 20% of GDP we're sucking down, but we're not delivering what we ought to be delivering for those results. And if we give you guys in education 5% of GDP, you could transform this nation, and we could easily cut it and not cut a single thing that actually helps anyone. So I do think that that's something that we have to discuss openly as a policy. Now, this is stellar. What else are you thinking? You have a few thoughts left.
Boy. I think we've covered. I think we've covered everything. I think you're right. I guess let's speculate on the future. I think best case scenario is kind of what you described. We have New York reopen, and we look at some of the southern states, and we see, hey, it's not so bad. And then there's political pressure on everybody else to reopen. So I think that's the best case scenario. I think worst case scenario is kind of the opposite, that, in the South, we have these states reopen without really good plans, without necessarily having the right equipment in place, and we get massive outbreaks, and that just delays reopening for everybody else.
I see.
And at this point, I'm not sure which of those two is more probable. I think I'm more on the pessimistic side, because I think we do have a lot of adult interests who really don't want schools to reopen. So they're just looking for every failure to bring it to their local school board and say, here, see what happens when you try to reopen, to try to, fight back. So my worry is that we're going to be doing remote learning, not just for all the fall, but really for the remainder of the year, and really until we get widespread vaccine. And I think that would be just incredibly devastating for, again, the most disadvantaged families and the most disadvantaged kids.
Oh, okay. That's a lot to take in. I mean, I appreciate what you're saying. I mean, we share all the same views here. Oh gosh, I hope it doesn't come to that. I think the adult interest is so torn. They're the interests of the teachers, and of course, I know what or at least many of their interests are. They're the interests of the parents who say, get these kids to school. At least a lot of them, but some of them I think also are fearful of their own kids' safety, which I think is sort of objectively not a fair assessment of the risk to the child. Gosh, it's a volatile time. Yeah, who knows where we'll be? It'll be one way or the other. I have a sneaking suspicion that if the election goes to Biden, the discussion will be different than if the election goes to Trump. If the election goes to Trump, it's going to be an uphill slog to get schools open because he wants the schools open. If the election goes to Biden, and we know that Biden is coming, I think a lot of people who are left-leaning will start to see the wisdom of having schools. So I don't know if you think there's something to that.
Yeah, so I mean that's a great point. So I think there is a really important piece here that we haven't talked about, but which is testing. So I think one of the most incredible things that's happened in public education in the last 20 years is we actually have data, and we can document achievement gaps, and that just has had some perverse incentives in terms of teaching to the test, but has also mobilized people, and it laid bare some of these inequities. And I think one of the things that's at stake in this election is are we going to have testing this year? Are we going to have testing going forward? And so I think if Biden wins, I think there's going to be a lot of pressure not to have tests. And I worry that in the long term, not getting that data, not being able to document the impact that COVID closures have had, and the inequitable impacts that they've had, I think is going to be a problem. So regardless of what happens in the election, I think we need good measures, and we need good data to see, to identify the impacts and to identify where our interventions are needed, because there's going to be differences across communities, there's going to be differences across schools, there's going to be differences across kids. And so having data is incredibly important. And I think that's one of the fault lines, unfortunately, politically, right now.
That's a fascinating point. Yeah, you're right. And along those lines, I think that if the board that says the number of cases in America, that thing that's on every newspaper front and center, if there was also a board of number of missed days of school that just kept running up every single day a kid is out of school, it would help people think about the trade-offs that we're actively making. But Dr. Kogan, this was a real pleasure. Love to have you back in the future when we can find something at the intersection of education and health. I feel like I learned a ton, and I think what you study is super important. Probably one of the most important things we have. And I hope that people will heed your advice, and whether or not, whatever choices we make in the short term, I hope we commit to making the long-term choices to do the best we can to either catch up or to do even better than we otherwise would. Let's take this crisis as an opportunity to do the reforms that are long overdue.
Hey, thanks for having me on. It's been a lot of fun.
I'm back here in plenary session, joined via Zoom by Dr. Dan Morgan. Dan Morgan is friend of the show, although maybe he won't admit that publicly. Dan Morgan is professor of medicine at the University of Maryland. He is a practicing infectious disease doctor. He is an infectious disease steward at the hospital. He does work on low-value care, evidence-based medicine, and doing some tremendously interesting stuff with a really great paper on how we conceptualize benefits and risks recently out in JAMA, and a great podcast that came out with Howard Boschner. And we're here to talk about something different. We're here to talk about statements and misrepresentation. So, Dan, it's a pleasure to have you back.
Great. It's great to be here, Vinay.
It's great to watch the end of your career right here on Plenary Session.
Yes, as I defend the Trump approach to COVID.
The Trump approach. Donald J. Trump's approach to COVID. Well, Dan Morgan, I think you've been on this podcast before. You put all your cards down on the table, and basically you made the argument that, you, like me, are a progressive left of center kind of person, and you are also an infectious disease expert, and you, more than anyone, understand the seriousness of SARS-CoV-2. You are a practicing doctor. At the same time, you also, as a progressive, understand the seriousness of responses to SARS-CoV-2. And so you realize that there are trade-offs that have to be made. And nobody knows the perfect answer to these trade-offs. If we did, we would be sort of superhuman. So we're all kind of making our best guess about these trade-offs with the, evidence that we have at the time. But we're here to talk about, I think, that there are, more and more polar extremes for these trade-offs. One polar extreme, I think, is the Twitter extreme, which tends to lean towards, I think some people are calling it like the Zoomocracy, where it's, people who predominantly have professions that they can work and live off Zoom. And so they feel strong pressure to keep things shut down for as long as possible, minimize transmission, keep schools shut down for as long as possible. And I think the other aspect of this is many people who are socioeconomically well off or have put their kids in private school. I've been doing some informal surveys. I find that many of my colleagues have done that. Anyway, we're here to talk about something particular. Dr. Scott Atlas. Dr. Atlas, of course, was the former chairman of radiology at Stanford University, and he is now Trump's guy. And maybe to some degree that doesn't help his image and reputation to be Trump's guy. But he has recently been the recipient of a strong rebuke from his colleagues at Stanford. They say that he has put forth, quote, falsehoods and misrepresentations of science. And I guess I applaud people at Stanford for being critical of the policy of Dr. Scott Atlas. I think that's a healthy debate. But I think the question is he guilty of falsehoods and misrepresentation? So are you ready to take a hard look at these statements by Dr. Atlas?
Reluctantly, I am willing. I should start out saying too that I think that we are in a tricky time. I think there's a lack of leadership, and the authoritarian tendencies by the president kind of ruins necessary trust to do a lot of things that are difficult but should be done, like opening schools and opening the country in other ways. So I do think there's a lack of leadership that has steered things in the wrong direction. And, ultimately the president is the most responsible person for that. But that being said, I don't think it means that because the president has done something wrong, we have to be dumb in response. And that is the part that kind of drives me crazy.
Yeah, I mean, I guess I agree with you wholeheartedly. I don't think there are many people who are going to look at the legacy of this administration and say, well, those are a lot of policy successes. They're going to point out that there are a lot of incredible blunders. And they're also going to see somebody who on many occasions used divisive rhetoric and further fueled tensions and escalated things. And that, to some degree, is not what many people look for in the highest office. And when you do that so often and you create so much bad blood among so many people, when things really do get crazy, I guess one shouldn't be surprised that there's not going to be a lot of trust and goodwill that's extended your way at the outset. So I guess I'm not surprised people are responding. But at the same time, when we're making these policy decisions where there is no perfect answer, where there are trade-offs, I think we can't let our opposition of even a very bad politician get in the way of trying to do what's the most sensible approach that balances the risks and benefits, the trade-offs, if you will. Although I shouldn't say risks and benefits. It's different here. I think it's known downstream harms at different temporal locations, with a lot of uncertainty around those harms and some uncertainty around even the benefits.
Yeah, no, I mean, I think that's key. And, when you mention, needing to try to think about what is the most appropriate approach in spite of the president, that really resonates. And I think, it was clear when, say people were debating how to open schools and if schools should be opened and in which way. And then the president weighed in and said all schools have to be open. He drove a lot of rational people to just become completely opposed to schools in a way that was discouraging as far as the kind of critical thinking on the part of academics, and colleagues, et cetera.
Yeah, I felt the same way. I mean, if it was a really hot day and you were thinking about going out wearing shorts and then Donald Trump went on TV and said, it's really hot, everyone should wear shorts today, I think a lot of people are going to wear pants and go out there. But, I think that's one of the challenges. But, hopefully you can say, well, even though this guy told me to wear shorts and even though this guy has done a lot of things that I'm not happy with, if I want to wear shorts, I'm going to wear shorts, and if I want to wear pants, I'll wear pants. So let's jump in. That's silly analogy, but let's jump in to Scott Atlas.
All right.
Scott Atlas, he was somebody who I don't think people thought of as being linked to Trump, but he has stepped up and he's joined and he's become linked, for better or worse. So here's what this is what the letter says. It says that he has said a lot of things that are falsehoods and misrepresentations of science. And I think it is possible that somebody says falsehoods and misrepresentations of science. A classic example would be that the MMR vaccine is linked to autism. That's a falsehood and misrepresentation of science and a very dangerous idea to put forward. So we all agree there is such a thing because, in fact, in well-done studies, it's not been linked. And in the thing that people think has linked it, that's a piece of garbage. That Wakefield paper, I don't know why they ever published it. It was never good to begin with. It was always garbage. It's not even good science. It was just a total joke. I actually read it a few years ago, and I was shocked at how bad it was. I thought it would at least have the illusion of science. It didn't even have that. Anyway, so let's go through his statements. So the Stanford professors responding to him, right? The use of face masks, social distancing, hand washing, and hygiene have been shown to substantially reduce the spread of COVID-19. Crowded indoor spaces are settings that significantly increase the risk of spread. I think most people would agree with that. Relevant examples, statements by Dr. Atlas. Much of the stuff on masks is not really good science at all. I'm not going to say this because very few people even talk about it. This idea that masks being necessary, particularly for children, is completely irrational. So why don't we just jump on those two? Much of the stuff's on masks is not really good science at all. What do you think about that, Dr. Morgan?
Hey, well, you know this quite well. I think you had a podcast a few months ago talking about masks, and it is one of these things where I think if people remember, the data that we had back in March when this all started, and the fact that none of us wore masks, around outside of the hospital, outside of seeing patients who were on certain precautions, and that was based on the best science from CDC and elsewhere. I think we agreed that there was just not a lot of strong science supporting masks. And, Oxford Evidence-Based Medicine Group, a highly respected group of epidemiologists, have pointed this out too, that there are a lot of low-level studies that tend to suggest there may be some benefits. And then there's actual cluster randomized trials with flu and influenza-like illness that don't find a benefit or find some confusing findings that maybe cloth mask or worse. And I mean, it really argues that we don't have high-level science, but, I think as you pointed out and others that, it's like a foreign policy decision. It's probably a very reasonable approach to use masks because the harms are pretty minimal, but the benefits, I agree, are not really proven. And, I think that he's going a little bit beyond, I think, what most people would say. But I do think that, Dr. Fauci and others back in March were saying masks aren't useful. And it's not like there's new data since then. It's the scientific perspective has swung, and you hear Tony Fauci backtracking on this.
Yeah, with all sorts of stories.
Like marginal effect.
Yeah, I mean, I guess I'd hate to say it, but I mean, you might not want to put it that way. I mean, you might want to say that, when there's uncertainty, we err on the side of precautionary principle. You might want to say that, but, I don't think you can, technically he's not inaccurate. Much of it is not really good science. I mean, it is what it is. I mean, we can, I think he has a leg to stand on there. And then the next part, that the idea of masks, particularly for children, is completely irrational. I guess I would jump in and just say, that's a really tough. I mean, I think he's not totally off the mark. That I think I'm not aware of any good studies in 4-year-olds, 3-year-olds, when you actually get them to wear the mask. Again, they're the theory that if they sneeze, it's going to be caught. But when you actually take a 3-year-old and put a mask on them, what will they actually do? It might be ending up, they might chew it, and the next thing their buddy might chew it too. I mean, who knows what's going to happen? I mean, what do you think there? The data on young children wearing masks.
So, I mean, I think anyone who spends time around kids can imagine like 3-year-olds or 4-year-olds and how they wear masks and, what they tend to do with their mouths and their hands, etc. And really question if masks are beneficial in that setting. I think there's just no data. And, when our state decided to mandate it for daycares, it made me question also if this was a good or even a possible thing to do. I think it's not unreasonable to try, but I think it's quite reasonable to say we don't know.
Yeah, I mean, at a certain age, putting a mask on a child is like asking a dog to wear pants. It's not going to stay where you think it's going to go. Let's see. Some of the other things he said that were wrong, they put in this category. There's no real good science on general population widespread in all circumstances wearing masks. I think that's defensible. The reality is that there's certain data that's very controversial about masks. Defensible. It's not logical that otherwise healthy adults, especially younger age groups, should be isolated and maintain a 6-foot spacing from each other. I guess that's a little different one. The distance one, I mean, I think it's theoretically logical. I would see requiring restaurants to put a guideline on the door that says if you're over 65 and you're diabetic, there may be a risk in being a small space, but that's very different from saying to a restaurant that they must have 6-foot spacing. A restaurant must have a mask. I think that's a very important topic. The science behind the 6-foot spacing is embarrassingly weak. I think he probably, if push comes to shove, probably that is defensible. That the exact, in fact, I think there is that BMJ article by Trish Greenhalgh, who is a mask advocate of the most prominent mask advocate, and even she is sort of critical of the exact 6-foot distance. I think he has a leg to stand on all those statements. Although I think there is sort of an intuitive logic to keep your distance from people, and and again, I guess it's not to say that. I actually do agree with keeping distance and hand washing and social hygiene and masks. I agree with all those things, but I think, can you really fault him for taking the other sort of negative spin of the study, looking at the same data? I think that's not really faultable. Let's go to statement 2. Transmission of SARS-CoV. Yeah, go ahead.
Maybe I just throw in, I agree with you. I use masks and social distancing, et cetera, but I do think that it's not a terribly science-driven approach. And I do think that's one place where the debate gets hung up, that people say, well, it's completely scientific that you're supposed to do this. And I think that, for aerosol versus droplet and 3 feet versus 6 feet versus airborne and any amount of feet is dangerous, all gets to that uncertainty that we don't have great data or great understanding. And so, I think that he may be skewing it in a direction that, supports his approach, but it's not that it's, false claims either.
Yeah, that's the key. I think he's spinning it in a way that serves what his policy recommendation is. But, that's the way academics works. People spin their stuff in the way they want to take it, but it's not, I don't think, technically on the face of it, a false claim. Let's go. Statement 2. Transmission of SARS-CoV-2 frequently occurs. This is what the Stanford, opponents think, the 100 faculty. And again, I also think that the 100 faculty are right in their statement that these things have been shown to I guess I would say that these things have a plausible reason to believe they would substantively reduce the spread of COVID-2 instead of have been shown. They may overstate it a little bit too, the other way. Let's go. Statement 2. Transmission of SARS-CoV-2 frequently occurs from asymptomatic people, including children and young adults, to family members and others. Therefore, testing asymptomatic individuals, especially those with probable COVID-19 exposure, is important to break the chain of ongoing transmission. Relevant statements from Dr. Atlas. The data shows it is rare or very rare to transmit the disease if you are asymptomatic. It is not common. In fact, it is rare to get an infection transmitted from an asymptomatic person. When you start introducing closure of schools because people have test positive, that's sort of not the purpose of testing. Okay, so here, what do you think? Here I think there's a debate here. What do you think about this? Certainly asymptomatic people do spread the virus. We do know that. That's true. But he's saying it's rare. And he's also saying that, if you're using the number of cases to close a school, that's not the purpose of testing. What do you think, Dr. Morgan?
Yeah, I think it's a few different issues, and it's kind of funny they put the quote about schools in with this because I think it's a little separate. But yes. We know that if you actually look at the data on people being able to have live virus cultured from them, the highest transmission periods are like the first few days before symptoms and the first few days after symptoms. And there's much less data on asymptomatic people. It's really not that clearly known. How many are asymptomatic or how transmissible they are. And we know that probably the biggest risk are like these super spreader events, which we don't know much about them, but like say a Zumba class in South Korea or, a choir in Washington State have spread in a big way. And that's probably related to very mildly symptomatic or asymptomatic people, engaging in singing or other activities.
Right.
We do know that people who are asymptomatic, at least in contact tracing, tend to spread it much less frequently. Like in a study from China, about 3% of patients who were asymptomatic spread it to others, whereas 13% with symptoms spread it, which, is not surprising. You're coughing, you're sneezing, you have symptoms, you probably are more prone to spreading a virus that's in the respiratory tract. And I do think that has become almost a touchstone that some people who advocate, sort of closure, shutdown at all levels tend to argue that asymptomatic is equally important or more important. And I think it's just not that obvious. And the data is hard to follow because we don't have like complete tracking of where people got it. And in the United States, certainly, we are not in a situation where contact tracing has much of a role because we have way too many cases, I think, to ever have a benefit from contact tracing until we actually get the levels down to much lower levels, which is hard to imagine that happening without herd immunity.
And I think that is well put. And I think that's what makes this a thorny issue because on the face of it, I think that Dr. Atlas has a different point of view entirely than the Stanford critics of Dr. Atlas. But I think I don't think I see anything that on the face of it is 100% inaccurate, that is really clearly at the level of falsehood and misrepresentation. I think part of the challenge is that these things are intertwined a little bit, which is I think Dr. Atlas is okay with people of low risk contracting the virus and developing some immunity levels in the population through that mechanism. The people who criticize him, do not like that as a strategy in any way, shape, or form. I don't want to call it the herd immunity strategy because it's not necessarily herd immunity that Dr. Atlas is supporting, but they would say that every additional case is a problem. And if you believe that, then it would be logical to test everybody and isolate. But I think there's a practical matter here, which is that even if we wanted to do it, could we do it? And when you're talking about, hundreds of thousands of people who actively have the infection at a moment in time and who are touching and meeting with people, in an exponential manner, the number of contacts we have. I mean, contact tracing may not be possible, period. End of story. Like, even if you invested a lot more money, you wouldn't be able to rev it up to where you need it to be with such a high fraction with the virus being so endemic. I think that's the debate to have, which is, are we going to get juice from that squeeze if we were to really rev it up? I think your point of view is the point of view that I fall at, which is that it'd have to be a lot lower for it to even be feasible. But I think the people who write the Stanford rebuttal, they don't feel that way. They think it is doable. The virus can be driven to extinction if we were to do it. Dr. Atlas disagrees. I think that's why the statements are a little bit different. Let's talk about the schools one. I think, again, it really has to do with what your policy solution is. Dr. Atlas might be willing to open a school and let infections start rolling. And the stopping rules for the school might be hospitalization. So when you get to, X number of people, staff or students hospitalized, then you would halt it. That might be a strategy for colleges as well. If you get X number of people hospitalized, that might be what Dr. Atlas is proposing as the stopping rule. But other people have been using, I think, raw cases, the number of infections, as the stopping rule. And I think Dr. Atlas's comment that introducing closure of school because people have positive asymptomatic tests, that's sort of not the purpose of testing. I think that's a bigger debate, and it is a debate that people could reasonably have without one side at the outset knowing the other side is really wrong. What do you think?
Yeah, I mean, that was one of the ones I thought was a very interesting quote, because I think the purpose is really all subjective. But if you look at all this data across like many colleges that are testing people, it seems crazy that they opened and planned to close if there were positive cases, because it's almost guaranteed. Right, yeah. You would think that you take people from different areas and you put them together, and they're, young people who are bored and tired from the lockdown already. And then you say, test them all the time. And if they're positives, then they did something wrong and we're going to shut down. And, I really haven't heard anything in the range of like how many people are actually sick. And you would think, if anything, this group of patients, it's, people from like 18 to 23 or something, would be incredibly low risk.
Yes. So I think I've heard a couple of things. The Alabama experience was everyone had to have a baseline test within 2 weeks of starting, but that's almost useless because you get test negative and you got 2 weeks to go have fun before going to college and you can get the virus. The other example, and then once you go, you only test if you're symptomatic, and then they had a bunch of quarantines, but it's finally, I think, cooled down a little bit. One of the other schools that, I forget which one, they had sort of a bi-weekly testing strategy. Now that's getting to the level where, maybe you're going to be able to find stuff early and interdict before cases. But I think there is a policy question here, which is, would it really be so bad if there are a bunch of cases? There is a certain complication rate, hospitalization rate, but in that age group, it's really, really low. I mean, there's also a risk by going back to college that there are going to be drinking-related deaths. That's a risk of college. Going to college, there is some risk of death. As there is with, driving anywhere. There's a risk of death with all these things. The question, of course, is what risks of death are unacceptable and what risks of death tip trade-offs. I guess it's an open question, and I think it is different in different age groups. And so, but the point remains, if your policy is at a certain case level, you're going to abort mission and close up what you're doing, well, you're destined to have that happen if your thing is like one test 2 weeks before you enroll. It's not very smart. I mean, the stopping rule is coming. You're going to stop that school real quick.
In testing, this is something that we get stuck with a lot in the healthcare realm, because there's a CMS guidance that you should have testing of all workers in nursing homes up to once a week. Which is nearly impossible to test everybody who works in a nursing home weekly.
Yes.
And now with a turnaround time of, 5 days or 7 days, you get to this reality that actually you're only infectious from about 5 to, really less than 8 days after a positive test. So essentially, like, anyone who's positive is probably no longer contagious by the time you get the result back. So it's like it's almost a protective measure. Like, if you tested positive a week ago, you should be fine now to work. and part of the reason testing is so slow is because we are using it so broadly. Like we are testing the worried well. Like everyone in the suburbs is going to get their test before they go on a hiking trip or something.
Or have a cocktail party. That stupid article I read about the Hamptons. It's ridiculous. Yeah.
And so, it's not like the test itself takes long. It takes like an hour to do in a lab, but the labs are backlogged because there's too many tests being ordered and run on people, and they're mostly low risk people and not really the people who should be tested if we're trying to actually target, those at high risk of complications and populations that may have it and not know about it.
Yeah. Let's go. We got 2 more things to cover. So statement 3, the Stanford authors. Children of all ages can be infected with SARS-CoV-2. While infection is less common in children than in adults, serious short-term and long-term consequences of COVID-19 are increasingly described in children and young people. Statements by Dr. Atlas. Quote, children have nearly no risk of serious illness from COVID-19. It's not just that children are not at risk at all from this disease. They also do not even transmit the disease. Children don't have any kind of problem with COVID from the data. We know that the risk of the disease is extremely low in children, even less than that of seasonal flu. There's no risk to children, no significant risk, I should say. Then what are you protecting them from? If kids get the infection in this school, that's still okay. I guess the only thing that I didn't like in that was that it's not just that children are not at risk at all from this disease. They also don't transmit the disease. There is a risk. It's non-zero, but it is less than flu at those age groups. Am I wrong? What do you think, Dr. Morgan?
I mean, this is the part. I mean, everyone, seems so inflamed by comparing it to flu, although, they're indistinguishable, as we may find this fall, except, in how frequent they are or the complication rates in older or younger people. And it's true in children, they're more likely to die of the flu than COVID. Mm-hmm. And I do think that his statements go a little bit too far as things.
Yeah, a little too far.
And it can't be transmitted. But even the transmission data that's from South Korea.
That was reassuring. Yeah.
Yeah, and Alistair Munro had a good assessment of some of the papers with contact tracing because they sort of lumped everyone in together and said kids are at equal risk of spreading it, or at least kids greater than age 10. But even that, it seemed like it didn't account for the fact that kids who were positive had an adult in the house who was positive often. So it does seem like kids are definitely much lower risk of spreading it and have really low risk of complications that is, lower than the flu. And it's not zero. There are kids who have bad cases. There are kids who die, and it's horrible. But, that happens with flu every year also.
Yeah, I think there are ongoing investigations that are genotyping a little bit of the people who got it from schools. So the question, of course, being, is the kid spreading it to the adult or vice versa? And so hopefully maybe we'll get some answers there. Now, the last 2, they lump together. So this is the last one. The pandemic will be controlled. This is the Stanford authors. The pandemic will be controlled when a large proportion of a population has developed immunity, referred to as herd immunity, and that the safest path to herd immunity is through development of rigorously evaluated effective vaccines that have been approved by regulatory agencies. In contrast, encouraging herd immunity through unchecked community transmission is not a safe public health strategy. In fact, this approach would do the opposite, creating a significant increase in preventable cases, suffering, and deaths, especially among vulnerable populations such as older individuals and essential workers. Dr. Atlas. We can allow a lot of people to get infected. Those who are not at risk to die or have a serious hospital requiring illness, we should be fine with letting them get infected, generating immunity on their own, and the more immunity in the community, the better we can eradicate the threat of the virus. Low-risk groups getting the infection is not a problem. In fact, it's a positive. The reality is that when a population has enough people who have had the infection, since these people don't have a problem with the infection, that's not a problem. That's not a bad thing. When you isolate everyone, including all the healthy people, you're prolonging the problem because you're preventing population immunity. Avoiding unnecessary requirements for spacing of customers, though, it's not logical that otherwise healthy adults, especially younger age groups, should be isolated or maintain a 6-foot spacing from each other. If infection is still prevalent, socializing among low-risk groups represents the opportunity for developing widespread immunity and eradicating the threat. In fact, infected people without severe illness are immediately available vehicle for establishing widespread immunity. By transmitting the virus to others in the low-risk group, who then generate antibodies, they block the network of pathways towards the most vulnerable people, ultimately ending the threat. Extending whole population isolation would directly prevent that widespread immunity from developing. We know from decades of medical science that infection itself allows people to generate an immune response, antibodies, so that the infection is controlled throughout the population by herd immunity. Okay, so what do you think about this? I think this is a tricky one because I think there was at least one thing he said that I was like, ooh, I think that goes a little too far. But he has a different point of view. His point of view is that we ought to let it spread in these age groups. Now, that's not a zero risk thing. That's going to have some casualties. I mean, we know there is a death rate even at those ages of like 18, 25, 35, 40. There's going to be some casualties there. What do you think, Dr. Morgan? Is it an acceptable trade-off, or is he gone too far?
I mean, certainly listening to his statements being read out loud, most of them I said, I would not say it that way.
I would.
Yeah. And so I would certainly not want to be the person who says, yes, I validate everything he says is right. But I think that there are elements of truth in many of the things he said. And it kind of reminds me, there was a New York Times article about the doctor in Portland who was a liberal doctor who said we should have like COVID parties. And he published an article in the Federalist or something.
Yeah, that's where he had to go. Yeah.
Like I was in my office at like 6:30 and someone from the New York Times called asking for a quote. And I was like, oh, that's a dangerous place to go. Yeah. But, essentially was getting at I dodged it enough. But, essentially saying like herd immunity, it ultimately is the goal, whether you get that from vaccines or other things. Like that's the way infectious diseases end. And, being opposed to herd immunity is kind of like being opposed to gravity. Like a certain amount of it happens.
Yeah.
I think that how you get to that and how people are informed in their role of choice. I think that, trying to have a policy that actively encourages people to get infected, most people would have questions about that.
Correct.
Unless there was full understanding on the part of those people. But, there are obviously a lot of young people, like in, the 18 to 25 group, who are going out there and doing things against the rules that are telling them not to. So, I think it would be one thing to relax the rules in certain groups as long as they seem to have some, as long as you gave them like adequate information. So it's very different, I guess, saying you have to be shut down, you can't do things, and you'll be breaking the rules if you do, versus we won't tell you you're wrong, but the most careful way is to still avoid these things. And if you think you're high risk, or if you don't want to get sick and have that low risk chance of something, then don't do it. But I do think that the idea that there will be a vaccine that will save us at some point, and we just need to hold on, is a bit of a dangerous idea also. We at the beginning of this, I've had this thought, and it hasn't changed, that, in America, we pretend that we're Germany, and the conservatives pretend that we're Sweden, but we're really like Iran. Like, we're obviously not Germany, which has had like widespread testing and isolation in a single countrywide system so they can track people.
Yes.
And they drove their rates down low. They may be subject to like second and third waves because it can still come back, but it seems like a reasonable approach. Sweden decided to kind of like let it happen and try to protect the most vulnerable, and didn't do a great job of that. But their death rate is still, they have fewer deaths population average than America does.
Yes.
And their rate is flat right now, and America's is still going up. So, and Belgium was worse than Sweden, but no one is saying Belgium screwed up.
Right.
Yeah. So anyway, I think that we don't have either of those. And, I just think there needs to be a better debate about, what is a realistic approach in the America that we have now, and not some theoretical America.
I think that's one of the key points, which is we have the America we have now, which is a fragmented America with socioeconomic disparities, which we're going to talk about in the education portion of this episode. And I think we have the America we have now, and we have to make the best decisions we can. Do I agree with everything Scott Atlas says? No. I think he says a number of things that are a little bit too much, push it a little too far. I think you feel the same way, not how we would say things. But I guess the question is, how should this debate happen? And, it's happening now with lawyers who are submitting these kind of like written things of misstatements and a defamation counterclaim, and then they have to provide evidence of why they said what they said, that he provided falsehoods. Oh boy, is this really how it should be played out? I mean, I think this is like the worst possible way. Like him or not, I think he's not an unintelligent person. There's a reason why he's a Stanford professor and he worked there. Do I agree with everything he's saying? No. Does he have a point of view that's different than other people? Yeah. But these are competing point of views, and I think the way to decide it is by people trying to argue and convince people in the academic spirit, and not trying to file suits and countersuits or wherever this is going. What do you think?
No, I mean, I agree. And I think Scott Atlas may have been the one initially filing a suit.
Oh, I see. He instigated it. Yeah. Okay.
I think he instigated, which I certainly don't support. But I think that like the tone and the rhetoric has been similar on both sides, that it's certainly not been oriented around saying, OK, well, you're right on some of these things, but you have the wrong plan based upon that, or something that would be more nuanced. Instead, it seems to be to dismiss everything that he's saying or considering, which, certainly I think tends to suppress debate and tends to suppress like the scientific approach to this. And there are some people, I think, on the liberal side who are making good arguments. There's actually an article in the Jacobin magazine,
yes.
Which is certainly like on the liberal side of things.
My favorite magazine I've never read in my life. I got to read that article. Yeah. Okay.
As of today, I've read one article in it.
I see. You now read one article in there. I guess, the reality of this debate on what to do with COVID policy is that the irony is also that the side in favor of sort of strict lockdown, strict measures, they're not winning their policy, because there are many places in this country that just don't give a damn, and they're going to do whatever they want to do, particularly red states, unfortunately. They can only shape the policy in the narrow spheres of influence that they hold. I'm not sure that's going to change that much, even if we had a new president, because this is not a lot of this is not federal policy. A lot of this is local and state policies. So there's going to be that. People on the other side, like Dr. Atlas, who favor, accepting a higher level of infections, I think outside of the vaccine setting, they also have to deal with folks who disagree with them, who will shut down colleges and universities and push back. So they also can't really run their experiments. So I think what's emerging in between is this, really interesting thing of what happens when you have a nation that is not central, not hierarchical, decentralized. You have vigorous political strife, fierce, polarized debate. No one has power to shape the whole place's policy. People have strong and different opinions. They don't want to talk to each other. They just want to silence both sides, have to silence the other side. I mean, I think the net result is the policy we're following is, what happens when everyone takes their hand off the wheel on the ship and it just goes where it goes. I mean, what do you think about that idea?
Yeah, I mean, if you look at, the rates and the way things are going around America, it just seems like, we have kind of a slow burn of infections. And,
yes,
to imagine that a vaccine will save us versus the fact that we'll just kind of burn out, it's really hard to say which one we'll get to first. But, it ends up being a mess of a situation that's, primarily borne by the poorest and least privileged among us, which is a sad reality.
And that's a sad reality. And we're going to be talking about that on the second half of this podcast, because I have Vladimir Kogan talking about education policy. But I think these are thorny issues. And I think he does say things that are very provocative. Some of what he says, there's a kernel of truth. Much of what it is, I think a reasonable way to look at the data from a certain point of view. It's interesting. It's interesting to do this kind of eval of it. I hadn't read that until today. And I hadn't been following what he's been saying.
Interesting. I mean, I definitely think that, we need national policy, we need guidance, but we don't have that option. And it just seems like we've devolved into the camps that are like fighting it out, but kind of for unclear, there's no win really. Like, win. If you get your op-ed in the New York Times, that's sure it seems good, but that's not a win. And it doesn't mean you're right either. So it's just a frustrating time.
Yeah, agree. Well, Dr. Morgan, thank you for your time taking us through this. We'll have to come back and talk more about the policy trade-offs, the challenges, and how absolutism in all its forms is poison. That's what a wise man taught me a long time ago. And I see absolutism on both sides here. The absolutism that we can drive this virus to extinction, and the absolutism that we can ignore this and it will solve itself. I mean, I think they're both sort of polar absolutisms.
Yeah, no, I agree completely. And, it's just kind of a slow, painful time to be an American. And that much more to try to run an infection control program.
Good luck to you, Dr. Morgan. Thanks for joining us.
Great. Good talking.
I'm back in plenary session, joined via Zoom by Dr. J. Bhattacharya. Dr. Bhattacharya is professor of medicine at Stanford University. He is both a medical doctor and a health economist, and he's done a number of important publications over his long career, now I think over 20 years plus at Stanford. And we're going to be talking about COVID policy. So, Dr. Bhattacharya, it's a pleasure to have you on.
Thank you for having me.
So, I have been following with interest your work in this space, and I think there's just so much to cover. So let's just jump right in. I mean, I guess one of the things I wanted you to explain a little bit is I think there's two things we got to get out as background. One, we have to talk about infection fatality rate and how it varies by age. And the other thing we have to talk about is what does it mean? What is years of life lost? So why don't we start with the second one first? You know,
Sure.
People who are not health economists, they may not be familiar with the concept of years of life lost, but I think it's an important concept to introduce because when we make policy trade-offs, we want to minimize years of life lost. So what is years of life lost? Is it ageist? Why do economists use it and think about it?
Why don't we address that second thing first?
Sure.
Second thing second, because
Okay.
I think the first let's define terms.
Yes.
So if someone is 50 like I am, I mean my life expectancy at age 50 is probably on the order of 25 to 30 years on that. I mean, I haven't looked up most recent numbers. So if I were to die today, I'd lose in expectation 25 to 30 years. Actually, it's funny thing is like I was born in India in 1968, and Indian boys born in 1968 had a life expectancy of 48.
Yes.
It was bimodal. So like, for instance, the reason why was because there was a high infant mortality rate in India at the time.
Yes.
And so a child dying at age 1 or 0, it's gonna have a big effect on life expectancy.
Yes,
whereas
massive,
someone
yes.
dying at age 85 is going to have a much smaller effect on the total years of life lost and on life expectancy, like life expectancy of birth, right? So the years of life lost is a simple mathematical concept, right? So is it how many years do you expect to have left given your situation? And how many years? And of course, that's going to vary by age.
Yes. And as you get older, I mean, if somebody is 80, they can still have 7 or 8 years. So it's not always what it is, the life expectancy at birth. It changes over the course of one's lifespan. Now that you're 50, especially, in 2020, it's probably something like 30 years of life left.
Unfortunately, 52, Vinay.
Unfortunately, yeah.
But yeah, I mean, that's exactly right. So it changes. Like the fact that I survived my youth
is good.
Vastly increased my life expectancy, right?
Yes.
So my life expectancy at age 3 was no longer 48; it was much longer than
yes,
that.
Yes.
And the fact that I'm now survived at 52, that means I still have, like I said, somewhere 25, 30 years in expectation left. So I think that's a really important mathematical concept. Just it's neutral in that sense. It's
neutral,
just a fact, right? So the question about what you do about policy, and that comes back to your second question about ageism. And so that is a much more difficult challenge. A policy that says we should only focus on years of life lost and say, okay, well, then we should just dump all of our resources only into infants.
Yes.
I don't think that's the right policy, right?
Okay.
I mean, it's not. We're not Benthamites. We're not. Say like.
We're not pure utilitarians. Yeah.
Exactly. Right.
Okay.
So there's inherent dignity in someone that's older, even if they have very few years of life left in expectation, and we as a society, I think, have an obligation to them as well.
That's well put.
But it's not infinite, just as it's not infinite to the youngest as well. So we have to think about balances and trade-offs, and I mean that's just standard health economics. I mean that's not like anything brand new or different. It's not immoral. It's just prudent. You have no choice in a world where you have limited resources. You have to make difficult decisions about how to balance these difficult alternatives.
Yes, that's well put, and I think you're right to raise that distinction that when we make these calculations, it's not a pure utilitarian calculus. To some degree, that's incorporated, but we also have to respect, I think, the dignity of people who are older. And then the other thing to add about years of life lost is it also includes your potential years of life include your comorbidities and your otherwise general health. If you're institutionalized or hospitalized in a nursing home, it might be far shorter than if you were 80, the same age, but otherwise in your own house and able to get around.
Yeah, exactly. I mean, I think that there's some aspect of that too. I mean, medicine is in part, it's not to like help us live forever. It's to comfort us when we're sick. It's to provide cures when they're available. It's a complicated set of things. And when we think about what the right thing to do is, of course, we need to account for what condition are you in.
Yes. Now let's talk a little bit about the other two concepts that I think we have to define at the outset so everyone is clear. Infection fatality rate and case fatality rate, of which you have you've dared comment on this space and you've paid a little bit for it. But yeah, you've dared comment.
I did not realize, I have to say at the outset, I mean, I did not realize this was like a massive political issue.
Yeah, I didn't know either. Yeah.
So case fatality rate is in some sense amorphous. So it depends on what you mean by a case.
Yes.
So if you look on the Hopkins, the pandemic site with the red circles or worldometer or whatever, you can very quickly get a sense of what the cases are. But it's a complicated thing, and those graphs hide a lot of important detail that's worth knowing. So a case is either somebody who has a set of symptoms that we think are consistent with COVID. That's how people diagnosed in the earlier days when the amount of testing wasn't really, adequate. Or someone who has been tested, typically with a PCR test, and positive for COVID. Right. So a case doesn't last forever. It ends in one of two ways. Either you are cured of COVID. I mean, it's not a virus like HIV, which hangs around forever, or even like chickenpox, which, varicella zoster, which hangs around forever. But it's a virus that either you're cured of it or you die from it, one or the other.
Yeah.
Or die with it, I should say. The cases then are an underestimate of all the set of people who have had it.
Yes.
So, in fact, it turns out the evidence shows that the vast majority of people who get it are cured of it. They have it. It's like in that sense, it's like the flu or the cold, right? Most of the people that get a flu or a cold, they're not people with colds forever. They had the cold and it's gone. So the same thing is true of COVID. Of course, the rate at which people die from it is higher than it is for a cold. Flu is more complicated. We'll come back to that.
Sure.
So the infection fatality rate is a different denominator than the case. The denominator in the case is all the people that have been designated as having it at one point, currently, right? That's essentially what you're seeing in worldometer or whatnot. The infection fatality rate is the total number of people who have ever had it, including people who weren't identified as cases.
Yes.
And why is that important? Because it turns out that the set of clinical presentations is absolutely enormous in this thing. It ranges from utterly asymptomatic, maybe somewhere on the order of a third, could be higher, could be a little lower. I'm not sure. I don't think I have a precise number. To people who have that severe viral pneumonia that makes the news, that kills you in the ICU.
Right. Who need ECMO. And that is sort of one of the more interesting things about this virus is that spread is so huge. And I guess the other thing interesting about the virus is that the infection fatality rate varies tremendously with age. The age gradient is, incredibly steep. Why don't you walk us through that? What does it mean for somebody who's 5 years old versus 85 years old?
That's such an important point. I think our policy absolutely needs to reflect that, because that's the central fact about this virus. If you're under 30, what the data currently shows is that your risk of dying of the flu is higher. If you're infected with the flu, you're more likely to die than if you are infected with COVID. If you're under 30, I mean, it could even move up to 40, but let's say 30 to be safe, because there's the numbers are in dispute.
Sure.
But that fact is not in dispute. Now, if you're over 65, it's much more deadly than the flu. there's on the order of 1,000 to 1 difference between the youngest people who are infected, what risk they face. It's actually on the order of 1 in 100,000 or lower. Fewer kids have. If you're a kid, if you're under say 18, you get this. There fewer kids have died of COVID than of the flu this year. That's absolutely a fact. Less than 1 in 100,000 death. And then if you're over 65, it's very deadly. It's on the order of 3 in 100. Right. To now more if you have comorbid conditions. This covers a lot of, sort of suppresses a lot of clinical nuance. Is very important too. But the first order thing is the age gradient. Now, why is that important for policy? Because it turns out that people interact with each other in predictable ways depending on their age. Right. So you actually get, people tend to interact mostly with people really close to their age.
Yes.
Like 50, most of my friends are in their 50s or a little younger. Now there's predictable changes in that. So like, for instance, you can get, a lot of 30 to 40 year olds interacting with children. That happens.
Yes. Teachers often. Yeah.
Yeah. Parents. And then also, older people interact with people in their 50s some.
Yes.
Because, you're like, I mean, I actually, like I have an 80-year-old mom. I'll interact with her, right?
Sure.
So but for the most part, 80-year-olds interact with 80-year-olds, 50-year-olds interact with 50-year-olds, and so on. Like it's with some spread around that. That has enormous consequences then for how we think about the disease, how to contain the disease, and who's at risk.
Well, one thing I want to kind of just to get, in addition to that, I mean, I think, so those are all extremely important. And then the other thing to kind of capture, I think, is that in addition to thinking about the infection fatality rate, I think the other thing that's sort of interrelated we have to think about is the absolute number of potential people who are at risk. And I guess, many people bristle at comparisons to any other disease because to some degree people at least believe there is some, intrinsic immunity to flu. The seasonal flu is a little bit different than prior years. It's not a lot different. So there's some people who have some sort of baseline resistance. At the start of this, people felt like there was 0%, baseline resistance to SARS-CoV-2. We now are learning that potentially there's some T cells that are actually that actually can cross-react with multiple coronaviruses. But I guess it's also worth stating that, there's a certain number of people at risk. Modelers are comfortable saying what that is, but I think those of us who are empiricists have some difficulty. There's a lot of uncertainty there. What exactly that fraction is at risk.
Yeah, I don't know that fraction either, but it's more than zero. It has to be more than zero. Like you can't explain the data out of Sweden, for instance, or many places where the seroprevalence data look like they don't look that impressive. 25% of the population, 20, and yet it looks like
the infection is curtailed. You can't explain that. And then the traditional model that the quote herd immunity threshold is 1 minus 1 over R naught. That doesn't quite explain it either, because that'll put it at about 60%, so it's,
that number is interesting. Like it comes out of a model where there's homogeneous mixing across across the population. But we just talked about how there is not homogeneous mixing.
I see. So that's one of the prerequisites of that model is that there's homogeneous mixing, and that may not be an empirical fact.
It's not. We know it's not an empirical fact. And the lack of homogeneous mixing is important because what that means is that it's not 60% of the population that needs to get infected. It's like which fraction of the population. So let's just put it another way: the set of people who interact with more people, who tend to interact with more people, those people are going to be more influential in terms of disease spread.
Yes.
Than people who interact with hermits who sit home alone. I mean, I think that's the idea behind the lockdown, right? Let's make us all hermits.
Right.
In order to slow the spread. But I think that's a really important fact, right? So that means that you don't need 60% or 70% or whatever the initial model suggested for herd immunity actually, I'm going to use the word herd immunity. I want to be very careful. I'm not arguing for herd immunity.
Right, as a strategy, I know. Fact, right? Yeah, that's got to be careful about that. Yeah. Go ahead.
But yeah, I think thinking about it as a single number is a mistake.
Yes.
Because it's not. It's more about like who interacts with who, given the situation we're in. And as economists, we tend to think about this as, I think, a little different than epidemiologists. People react to the threat of disease in their own personal behavior.
Of course, yes.
Sweden didn't have zero reaction to the disease. If you look at the mobility data in Sweden, they dropped just like everyone else in the world as soon as the threat of the disease.
By that you mean cell phone tracking data. Cell phone tracking data tells a story that when people get scared, they watch the news and they hear a lot of COVID deaths, they change their behavior, period, regardless of what a lot of policies are done.
Yeah, and so you don't need a lockdown policy to when people are scared, they will interact less with other people.
And when they're less scared, they'll interact more. So that's the other thing. So even if you don't liberalize the policy, when they're less scared, people will do what less scared people do, which is go out on dates and go out to picnics and do things like that when they're less scared.
Yeah, no, exactly. I mean, they'll live their normal life, right?
Yeah, and
I think that idea also needs to enter policy really carefully. So, like thinking about a policy of essentially a infinite lockdown until we get a vaccine is not consistent with what we would expect anyone to be able to do. Another way, you would need an enormous draconian state response to try to enforce that. That's not consistent with, I think,
a free society. I mean, I think you can do that in a dictatorship, but you can't do it in a free society. People will revolt and rebel. And sometimes one of the things that's challenging is, this is one of the things I think about, which is how do you handle someone who's refusing to wear a mask? And sometimes they call in the police and they escalate the situation. But one of the challenges with that is in an effort to police it, you may, spread it much more because you're getting a ton of human interactions going on. That's just one sort of microcosm in which this can kind of take place.
I think that brings up a really important point. You're absolutely right. The key thing to me is when we think about public health responses, we need to understand what the constraints actually are, not what we wish they were. Right?
You wish you could snap your finger and put a mask on the guy. You can't do that. You're going to have to hold him down, drag him to prison, put him in the back of a car. He's going to be coughing on the cops. He's going to be coughing on the intake. I mean, realistically, how are you going to get this person who doesn't want to wear this thing to wear this thing? And at some point, is the juice worth the squeeze, or is it not worth it at all to police it? That's the challenge.
I mean, I think that's the issue, right? What's the constraint? And if you have in the back of your mind that there is no constraint, you're going to make a big mistake. You're going to be, you're going to be frustrated. You'll be like, how come no one's listening to me? Right? How come we have to push this? I think that's a lot of the root of the public health. The problems I've seen in the public health response is this sort of lack of respect for constraints that comes just from humans being humans, people being people.
I think one of the things that, perhaps you and I and others have a little bit of this perspective is because we've had some clinical experience in our lives. And we know that often the doctor knows if I do X, Y, and Z, things are going to go perfect. Then you actually go there in the clinic and you try to get X, Y, and Z done in the real messy world of real people who don't always remember to take their medicines and don't always want to do these things. It's not always as simple as the model. And sometimes I worry that some of the people who've had a very sizable and oversized role in policy making, they don't have that sort of rubber meets the road experience of how challenging things are, how unanticipated consequences arise, and how sometimes plans sound perfect, but when you get to the reality of people who don't always agree and have different feelings, it's not so easy to implement in this perfect way. And that's the real policy. Good policy works among people as they are, not as we wish they were.
I think that's really wise. Although I should say, I don't see patients for a living. So
I know, but you previously,
Like my wife is an oncologist. She comes home frustrated because she had like a patient with cancer. She's told them to stop smoking during the chemo, during the radiation therapy or whatever, and they won't do. I mean but that's just. I mean, but what do? Do you go to their house and force them to stop? I mean, you can't do that.
Can't,
as a doctor. What you give good advice as best you can. You try to connect with the patient. So that they you try to make an impression where they are.
Yes, and that's a great example because let's say the patient has head and neck cancer and you're delivering radiotherapy. There is a risk that if you push the gray to where you want it, and they're smoking all the time, they're going to get terrible mucositis and it's going to be even worse. You wish they would stop smoking, but at some point you have to lower the radiation dose. Is it suboptimal? Yeah, but that's life. You're not going to be able to do everything you want to do because people are not always going to do what you wish they would do. And I don't think they're necessarily bad or good. It's just people. People are people. Two things I wanted to add real quick to sort of what you're saying, because I mean, I think there are things you've said elsewhere, and I think they're astute points, which is, you're fully cognizant that IFR is not a fixed thing. It is a product of how overwhelmed the healthcare system is, the prevalence of treatments, the particular age and comorbidities of people getting the disease. It's a moving variable. And the same thing is true for the herd immunity threshold. It's a moving variable. If people's behavior is suddenly parties and, you call it homogeneous mixing, but the way it looks like on a screen is like the tennis ball model where everyone's just bouncing around. The truth is we are not bouncing around like that model. But if we start bouncing around more, then that percentage of people who are going to be infected is going to go higher before things start to cool down. And if we start mixing less, it's going to go down. So these are all kind of moving targets.
Yeah, and then let's connect it back to one other thing we just talked about before at the beginning is the infection fatality rate. Who do you want to get this? I mean, it sounds like nobody in some wishful way, but that's not possible.
Right. That's not.
I mean, I think that right now it's like something already ordered like 60 to 100 million Americans have got it based on the infection fatality rate,
sure.
the seroprevalence data.
Yes.
Okay, so if that's true, and you're going to allocate the 60 to 100 million, who do you wish had it?
Yes.
Well, of course, the people who had the low mortality rate from it,
of course,
the vanishingly low mortality rate. That's who sort of the right. Like if you were to step back and say, now you don't have in the option space, let's get rid of it. Yeah. I think that also has been at the heart of a lot of poor thinking on this, that disease eradication is somehow possible. That was never possible. Not in January, not in February, not in March. It was already too late, I think, in that sense. And we actually, funny enough, I think we still premise our policy, people premise their policy recommendations on this notion that we can eradicate the disease.
I think many people still believe that with the prevalence rates of right now in middle of September, that starting the fall, that we can eradicate this through contact tracing. But, contact tracing is easy to do when there's 5 people. It's not so easy to do when there's 5 million people.
It's impossible. It's impossible. Yeah, and I mean, if there's 50 to 100 million people in the United States that had it, eventually, I mean, at some point, your contact tracing circles, as they go out in concentric circles, is going to encompass the entire country. And actually, it's the other coming back to this question about like we should treat humans like humans. If you are contact traced, okay, Vinay, you got the thing. And you and I interacted over Zoom. I don't know if you know, but you can pass the thing over Zoom. The contact tracer shows up if you talk to the contact tracer, would you give me up?
That's a terrific point because there have been some studies that show reluctance of people to name other people they've interacted with, and that is not equally distributed. People from marginalized or poorer groups are perhaps more reticent in some things I've read. For good reason, right? Yeah, because that's
if you give me up, that's 2-week quarantine for me.
Yeah, right.
And you don't want to do that. I wouldn't do that to you.
Let's say you're a single mother, you're working, you're working somewhere. If I give you up, that's a loss of livelihood to you. I might be reluctant to do that.
Yeah, and LA County, I saw a story. Apparently, 60% of people contacted by contact tracers won't cooperate at all.
Yeah, I saw that.
And that's not surprising at all. They're not criminals. They're people who had this condition.
Yes.
Asking them to give up their friends and impose costs on their friends in this way, especially when it's the case where we have a regime where you're going to be in quarantine even if you don't have the sickness, right? Because we won't know for several days because it takes several days for the test to come back, and even after the test come back, some places keep you in quarantine just in case, I guess. I mean, with that system, there's no chance of contact tracing working.
Let's talk about one sort of concrete policy example, because I think this is something we can walk through. I think one of the things I struggle with is I think some people who think about what's the right thing to do. I mean, I guess one thing to say is that it doesn't matter what training you have or what background you have. Everyone thinks they know the right answer. I mean, I'm often struck by how confident everyone is. So confident. I read a summary of one article and I know what's the right answer about schools. But I spent a lot of time because I didn't know the answer. I didn't have what my answer was. But I've spent so much time reading articles and I'm trying to sort of piece it through. And I started by writing down, just a list of domains that I thought would be important. And I'm going to ask you about the schools question. So why don't we just focus on, I think, less than 16 years old or less than 12-year-old school children. So this is an important time in development. And I started going through and I write, if they have in-person versus online school, with the constraints of the reality, which is not everyone has laptop, not everyone has Wi-Fi, not everyone has a parent who can sit down next to whatever, a 5-year-old and hold them down for getting through school day. With the constraints we have, what are the benefits to the kids' education, kids' social development, the risks to the kids' health in both these scenarios, the risks to teachers and teachers' health, the risks to parents and their career, and then sort of those unanticipated effects like, you're never going to be able to shut down all schools. Private schools are going to go full steam. And so people who have money will start to pull their kids out of schools. And then what might remain, and I've been reading some articles about this, is, this is just one sort of unintended consequence people didn't see, was one of the reasons schools are good is that some people in there have money and are advocates for the school. They're often socioeconomically advantaged people. If they start moving their kids to charter schools or private schools, that public school is not just going to suffer this year, it's going to suffer for the next 10 years. So these are some of the broader unanticipated effects. So I wonder if we might walk through, and maybe you have other domains that you think about, but I think maybe walk us through.
You covered a lot of it well, but let me just, can I just talk, start with like, what is the data? What are the data on school safety? Okay.
So we're going to start with the bucket of like, what's the risk to kids and parents and the teachers?
And teachers, and then move out from that, because what you just described is a incredible agenda and not wrong at all. And I think you're exactly heading in the right direction. So first, we talked about the infection fatality rate among kids. It's very, very, very low compared to many other respiratory diseases that kids face. And that is enormously good news. Enormously good, because if you had a virus that had a 2% infection fatality rate.
Yes.
In kids, I wouldn't send my kids to school.
Of course, that's a steep rate.
Yeah, I mean, I don't want a 2 in 100 risk of death for that. Especially if I could just figure out some way to educate them at home. A 1 in 100,000. Well, I mean,
that's the risk of taking the bus.
Yeah, let me put it this way: it is more safe to have our kids, from the kids' perspective, as far as the kids are concerned, in school than to leave them at home. It's more risky to leave them home. For kids, schools are not simply places for education, but also places for nutrition. I think a third to a half of our kids have either subsidized or free school meals. They get most of their calories in schools. Yeah. The abuse is picked up in schools. Yeah. Child abuse is picked up in schools. For mental health, it's enormously important. Youth suicide, adolescent suicides are picking up, and not surprisingly, like kids are meant to be in community with one another. If you have special needs, that's where parents with kids with special needs tend to get their services. So I think just from a perspective of kids themselves, the services provided in school are irreplaceable in person in school. Whereas on the other side of it, you have this 1 in 100,000 risk to them, additional if they happen to get it. Right?
Yes. And you say that because based on IFR data.
Yeah.
Yeah. And you're talking about the age group, particularly, above the age of 5 and below the age of 15, say.
Yeah.
And I think you're
on that order.
Yeah, on that order. Because we're talking about a 2 in 1,000, 2 in 1,000 to 3 in 1,000. That's roughly the IFR in everybody. That's the average.
For kids, it's much lower. It's 1,000 to 1, just we talked about, right? Yeah. So it's a 1 in 100,000. Yes. I think for kids, for mortality.
Right.
I will expose my kids to a 1 in 100,000 or 200,000 risk.
But Jay, I think you do it even when there's not COVID, right? Your kids walk to school, they take a car to school. That risk might not be out of that ballpark, kids who have to travel to school. You're already exposing your kids to that risk when you send them to school anyway.
For the flu.
And the flu seasons, right? Yeah.
Yeah, I mean, there's all kinds of infectious diseases that we live our lives around. We don't. I mean, this idea that we can somehow eradicate that risk altogether is a mistake, right? It's always this question of trade-offs.
Okay,
and that trade-off is not. It's not. I mean, I suppose it's possible other people could differ, but I think the vast majority of people, but just based on their behavior alone, they send their kids to school.
Yes, they make that choice. They vote with their feet every day.
Yeah, exactly. So I think that's the right and prudent choice.
Okay, now talk about the teachers.
Right. Okay. So now here we have this absolutely remarkable set of facts that I did not expect at the outset of the epidemic. And you talk about reading. This is something I've learned and I've never expected, which is that it seems like kids pass on the disease at much lower rates to adults than kids than you would expect. In fact, many of the people have studied it very closely, including collecting data on it from around the world, say things like, we can't find a single case of a kid passing it to an adult.
Yeah.
And they're like these detailed contact tracing studies from not just one country. I think 20. I've read papers in 20 some countries, like Iceland, Finland, Sweden, Denmark, Ireland, the UK. You name the country that has looked at this, and they conclude the same thing. That in some sense, the adults at the schools are more at risk as far as COVID goes to each other.
Yes. And to giving it to the kid. There's some ongoing genotyping studies that will hopefully result in the near future where we will get even more evidence. But, my reading of the evidence is the same as your reading of the evidence, which is, this is such to some degree, I guess, it's very unusual that there's a virus with a steep age gradient and that the youngest people aren't primarily spreading it. It's a very unusual virus in that sense.
That's a remarkable fact that has come out in the medical literature, in the medical literature. But for some reason, a lot of people haven't absorbed that fact in their commentary about schools. They still think about this as if it were the flu. Yeah. So this is a good example, I think, of where the analogy is important. By the way, I think these kinds of analogies are very helpful because they give a frame of reference, but you have to understand that they are actually different things. You have to say based on what they are. So I think, but here the flu really the flu analogy sort of breaks down. Kids pass the flu from kids to their parents and to their parents. Teachers. They absolutely do that. Yeah. There's no question about that. Now, the other remarkable thing about this literature is that it's at the same time this literature is finding this sort of remarkable empirical fact that kids pass it on to adults at lower rates. It's also finding that kids have the virus in their nostrils at very high levels if they get sick.
Yeah.
Or if they're infected. Actually, sick and infected are two different things in the case of kids.
Yeah.
It turns out that now I don't think we fully understand the reason. I think maybe it could come back to the T cell sort of mucosal immunity you were talking about earlier. But for whatever reason, the kids have the virus in their nostrils, and they don't pass it on to adults. They're not infectious. Now, it could also be that there's this emerging literature on and this is something I didn't know or didn't appreciate in the early days of the epidemic. The PCR test we think of as perfect is not perfect. Yeah. There are actually a lot of false positives potentially. And it depends partly on how many times you PCR, you double the amount of genetic material with each cycle. That's how PCR amplifies. You have 1 copy, 2 copies, 4 copies, 8 copies. You cycle. It turns out that if you cycle, suppose you need 35 cycles, so 2 to the 35th copies before you've decided that the virus is present. It turns out that for the most, the evidence that's emerging is that if you need that many cycles in order to detect the virus that was originally present wasn't that infectious, was at such a low level that it wasn't that infectious. So it could be that you have viral load, but the viral load is too small to be infectious, or it could also be that kids tend to respond to this asymptomatically. And so they're, asymptomatic people pass on the virus at lower rates. The thing mostly spreads by droplets, right? Mm-hmm.
So I guess, to sort of, I think you're getting into some of the potential mechanistic reasons why, biological reasons why this might be the case. I guess another thing could be the different type of antibody response, mucosal antibodies or IgA antibodies. I guess, to be honest, to some degree, we won't answer that question, but it appears to be from the best available evidence that this is sort of an empirical fact. And putting it all together, I guess your summary would be that although you would acknowledge that by running schools, there is going to be some risk to the teachers, that risk is not zero, but that risk might not be a whole heck of a lot higher than a rip-roaring flu season. It might be something in that ballpark. Nevertheless, it should be something considered. And their IFR is certainly higher, but thank God the IFR for a 40-year-old is still not, the worst IFRs like this virus can get in the higher age groups. And so you might be willing to say something like, if there are people who are 55 plus, or have medical problems or are particularly concerned, we might make some accommodations for particular individuals. But, a young teacher, 25-year-old teacher, 30-year-old teacher, not, who is sort of living by themselves, not too worried, in good health, if that person wants to go and teach, God bless him, just like I'm attending on the wards, stuff like that. We do our jobs, in sickness and health. Yeah.
I mean, teaching is an essential service.
Yeah.
As far as, I don't know legally, but it is from my point of view. As someone who values education, I don't think it's just an essential activity.
Yes.
And we should treat it like an essential activity, just like other essential activities. We take precautions to protect the people engaging in them. So you wear PPEs when you go on the wards. You absolutely must. Especially if you're treating a COVID patient, you're going to wear it, or a tuberculosis patient, or
right, of course,
whatever,
yeah.
Right? Now that is absolutely true. So we work to protect them, but the job has to get done.
Yeah.
It's vital for society that we educate our young.
And for me to go to clinic. And so we're talking about the bucket of the safety bucket. Let's talk about some of the other buckets that people don't talk so much about. I think people think that educating a child, it's just like giving them information in their brain. But it's more than that. As an economist, there have been a number of studies that link educating to a child to their long-term career outcome, the amount of money they earn in their lifetime, and that may be a proxy for their longevity, their ability. And then the other things that are hard to articulate is that educating a child allows them to participate in political processes with some information, some civics knowledge, understanding how the world works. Educating a child allows them to pursue different things in their life. It allows them to be born in the lowest socioeconomic class but die in the richest. It is an incredible transformative thing that liberals and progressives have long championed for good reason, because it changes the life course of kids. I wonder if you might want to talk about that.
Yeah, I've never thought about it as a political issue. I think everyone, liberal, conservative, whoever you are, values educating your kids, educating kids. Our civilization is transferred by that process of education. And as you say, it has long-term consequences. Both, this is actually a classic thing. If there's one thing I know in health economics, the health economics literature is absolutely solidly established, is the long-run consequence of education on health.
Yes, it's solid literature.
Yeah, kids that you have, there are studies like if when the mandatory
age for kindergarten,
age of having to be in school went up by a year. 50 years later, there's less diabetes in that cohort. Things like that, right? Yeah. There's stuff you would, in some sense, you look at and go, can that be? But of course it can be, right? Because that education has these long run snowball effects that change your life fundamentally, and including making you want to invest more in your health. It just must, and that's what the empirical literature suggests.
Yeah.
So there's long run health consequences. There's also long run job and other consequences. So for instance, there's an OECD report that's just about to come out that I was reading a few days ago that says that the stopping our kids from getting this kind of in-person learning for just a year will have a 1.5% hit on our GDP.
I saw that. Yeah. Like $12 trillion hit or something over time.
Yeah. That's just mind-boggling, right?
Yeah.
Poor people, we are going to be a poor world as a consequence of these lockdowns. And that itself has a hit on our health.
Yes.
Right. So, it's not for, life expectancy has been going up continuously more or less for the past 100 years.
Yeah. With recent exception. Yeah.
Or longer actually, but in conjunction with our getting richer.
Yeah.
Those are causally connected things. If we get poorer, we will be less long lived.
And I think that's important to state because education and money are also health. It's not money or health. That is a vehicle for health. It's a vehicle for prosperity. And it's a vehicle for health, often for the most marginalized people, the people whose parents were poor, grew up poor, and their children have opportunity for something better. I think education, early childhood education, is the only thing that if Donald Trump says, I support that, people may not actually just, they may not actually not support.
You got to be careful.
You got to be careful. If he says it.
Yeah, he seems to bring out very strong feelings of people.
Yeah, we'll come to that.
But actually, I want to this is really worth spending a little time on today and you made this point. I know this intervention, this lockdown, and the shutdown of schooling will certainly do more to expand educational inequality than anything that we've done in 50 years.
Yeah. That's important to say. And then let's talk about the last bucket I wanted to talk about, which is the kids' mental health. You alluded to it. To some degree, it's a tricky issue. I've looked at some of these studies and I thought some have holes in it. I mean, of course, kids have a lot of anxiety and stress now, but, it's hard to tease out the two things, which is how much anxiety and stress is from being cooped up with your parents all day and how much anxiety and stress is from the fact that everyone's under anxiety and stress. I think that's a difficult thing, but I think there are some important things that we do know. One, many commenters have been concerned as childhood life is increasingly moving from in person to virtual, that there have been lots of unintended consequences of that. Anxiety, depression among children, particularly girls more than boys. The virtual world is not the same as the real world. There's a reason why you have to see people face to face. There's a reason why it's nice to have a conversation and there be no record of it forever. I think there are some serious downsides to social media. We are taking a social animal and we're moving them in a way that's unprecedented, that this is some, kids who've never moved in this way. That is liable to have serious, I think, psychological implications for those kids. Maybe walk us through some of your thoughts on that. I mean, I think we have to acknowledge there's some uncertainty here, but it's reasonable to think that it's good for kids to play on the playground. There's a reason why we've done that for 100,000 human years. Yeah.
Yeah. No, those socialization things have long-term psychological consequences, no question. And I agree with you. The literature on this right around COVID there's some challenges in sort of sussing out exactly the causality. But you have to look at the broader context of the broader literature about loneliness, about disconnection, and the connection between that and psychological distress, the depression, suicidality, all those things. And there, I think the literature is pretty strong. I mean, there is a very strong literature that suggests that if you're disconnected from your social group, I don't think anyone thinks that the online is an adequate substitute for that, and especially for younger people, that's going to have consequences. Specifically around COVID, yes, the literature I think still needs is still in play, but I don't think that conclusion. I mean, it would surprise me to hear a psychologist tell me, it's good to be alone. Yeah. Actually, for young adults, it's absolutely shocking, right? So there's a CDC study saying that 1 in 4 young adults seriously considered suicide in June. Yeah. Seriously, it's for them. Remember, the COVID mortality risk is relatively low. There's anxiety around the fear of COVID, of course, but a lot of that is the lockdown in June. Yeah,
fear of, that was one of the studies that that's a concerning figure. There's no doubt about that. And I think to some degree that's driven by social isolation, to some degree that's driven by perhaps their parents are struggling financially to some degree. And these are all products of the human response to COVID-19, maybe not so much the virus itself.
Yeah, even for older people, like I've worked on loneliness in older populations. It's deadly there too, right? Yes. It's a great killer. It's not an accident that the UK has a minister of loneliness, literally an official government position. I mean, I think this is one of these underplayed aspects of this. In fact, undoing it will be one of the most difficult things.
Yeah, it's not so easy to undo.
Now come to think of each other as just vectors of germs. Yes. Rather than people to get to know and enjoy and learn from. Yeah. Or do stuff with. I mean, I don't know. Like it's I think how to repair that connection is going to be a very, very difficult challenge.
Absolutely agree. And I guess the last thing I'd say on this point before we talk about the overall takeaway message, the last thing I'd say on this point is that for years to come after this, with what has happened to date, there will be more and more stories of children coming out of the woodwork saying that when I was home, I was sexually abused and I was physically abused for months. I had no one to tell and no one came to my rescue.
Yeah, I mean, that's abuse is picked up in schools.
Yeah. So putting this all together on the schools issue, I guess I'd say, what's your takeaway? Should we be doing everything humanly possible to getting schools running in person less than 12?
Yeah,
or less than 16.
That should be, if not the number one national priority, pretty darn close to it. It is absolutely not even less than 12. I'd say even into college. Yeah, I think colleges should be open. I think schools should be open. Now we have to take precautions, of course. We should treat them as essential businesses, just like we treated other essential businesses. this is an absolutely vital function of our society. And we've decided for some reason that it's dispensable. It makes no sense to me. I mean, the evidence on this is so strong from a scientific perspective. And if you just look at the COVID side, even that, the risk is to the people that we're sort of dealing with, which is the kids and these college kids, the risk is really low. We're essentially asking them to give up their part of their future so that I, the 52-year-old, can have a marginally decreased risk of getting COVID.
Well, and then I would also argue that that you, the 52-year-old, or someone, the 64-year-old, will have a marginally decreased risk. That is uncertain as well. It's not entirely clear that you will have. It's potentially possible that by these kids getting infected and overcoming it, the risk to you might actually be better in the future too. Yeah,
I mean, I think the key thing is, again, the non-homogeneous mixing, right? So if it's the case that it runs through that group, and so that essentially they've reached a point where there's no additional infections in that group, they're the ones who connect with other adults, right? I interact with 50-year-olds. I won't get it, but if I happen to interact with my students and they don't have it because they've already had it, then I mean that's one mechanism of sort of addressing a respiratory infection like this.
Let's talk about stopping rules. I mean, one of the things that troubles me about this space is that people have set up a stopping rule that is an illogical stopping rule. So what do I mean a stopping rule? When you run a clinical study, of course, if something bad happens at a certain number of bad outcomes, you're going to stop the whole thing. You don't want any more of that happening. In this case, colleges, the stopping rule has been the number of COVID infections. That's not a sensible stopping rule. The stopping rule, I think, should be the number of hospitalizations. If you have hundreds of kids hospitalized, okay, then we're going to stop. But merely having a mild COVID case in a kid, that to me it's not the bad enough outcome to stop the process. What are your thoughts on that?
We've had none. I mean, I think we've reopened schools in the fall. The schools that reopened in the fall have had tens of thousands of cases and not a single hospitalization as far as I know. If there's one or two, I mean, it might have happened, but it's very, very rare.
Yeah.
And no deaths, right?
And no deaths. Yeah. At least in colleges.
Yeah, the college students, right? So I think there is a negative side effect from excess testing, and that negative side effect is panic, right? So, and it's led to needless shutdowns, as opposed to what could lead to is okay, we're having what looks like to be in a little bit of an outbreak, it's not even an outbreak, a set of people who are getting the evidence of the virus. Let's take some more precautions about slowing the spread. But that may involve more PPEs, having some of the classes more online. I mean, I don't know what.
Yes.
But it can't be let's shut the school down, because the harm from shutting the school down is so high.
Yes. And certainly if they shut the school down and send the kids home, that's even worse. That's the dumbest thing I've ever heard.
Can I say one more point about the testing, about testing for people who are really, really low risk. In addition to causing panic, it's kind of futile, because if you really want to understand disease spread, testing for PCR is really just it's a mistake in some sense, right? You're not, you're looking for viral loads that are really low. They may or may not be infectious. And then furthermore, if you really want to understand how many cases there actually are, well, we already know it's somewhere in the order of 10 to 6 to 24 times. That's what CDC says. Then the number of cases that are identified. Well, I mean, what's okay? So you look at a blip in case here and there, but we know it doesn't run in parallel or proportion. There's 6 to 24 times more cases floating out there that you've never caught.
Yeah.
What for? What's the purpose of staring at these case numbers as if it were a guide to policy when it shouldn't be?
Yeah, and I guess that the case numbers can mislead in a couple ways. One, I mean, as we pointed out, I don't think it's the right stopping rule. If there's going to be a stopping rule, it should be some hard outcome where people are really suffering, not really getting sick. Hospitalizations or death.
Absolutely, yeah.
And then the next thing is, if we had a ticker up there next to the number of COVID cases that showed the number of kids being sexually abused, physically abused, suicidality, thinking, and the number of years of life lost from their longevity, you had all those tickers up there, I think people would feel different. I mean, the tickers, it is a powerful psychological thing to see that ticker go up. Yeah.
And the excuse can't be all those numbers are uncertain.
Yeah. But because this, right.
I mean, God knows that the numbers that we see on COVID are uncertain. But we absolutely, the psychological salience of the cost of the policies have to be put in front of the public just same as the benefits.
Yeah.
You can't just say, oh, look at the benefits alone and pretend like there's no cost, or don't make the cost psychologically salient. Real people are killing themselves. Real people are suffering catastrophic loss to their income. Real people are not bringing their kids to get vaccinated. Real people are not going to get chemotherapy because they're too scared of COVID to go to the hospital.
Yeah.
I mean, that's happening.
Yeah.
Make those costs salient, because they should be salient.
Now let's talk about the world as it is. You know, we made a point that that we have to treat the world as it is, not as we wish it were. One of the ways that feeds into the schools discussion, which I think we can finish the schools discussion with this, is I did some, so I spent some time trying to figure out which schools are actually closed, which schools are actually open. And I felt there were some sort of serious differences. So one is, a lot of private daycares are actually open because, of course, they're private. They can do as they wish for they have a lot of freedom. A lot of private schools are open. A lot of my doctor colleagues, they're sending their kids to school. And they say things like, well, if they were at home, they'd be going crazy, and they'd be going crazy too. Of course. I mean, that's how people feel. A lot of different states have different sort of appetites for risk. And there are a lot of states where they're pushing kids to school. And I hated to say it, but when I looked at a map, it looked to me like there was sort of a red state, blue state divide. And so then I took it away and to say that, like, really the policy discussion here is not open schools, close schools. It's really a lot of people are going to open schools. For-profit college is going to open college. They're going to try their best. They need the money. The places that are closing the real question is, in a bunch of blue states and poorer districts, are you going to close the schools there or not? Or are you going to join everyone else? That's the real policy question.
Yeah, I completely agree. There's this sort of like this inequality angle that sort of people don't understand it, which is really important here, right? So. Yeah. You've heard of these pods, right? Where people will hire essentially teachers to come and teach 3 or 4 kids that are neighbors of each other or something, so that they can learn to read as a first grader. Whereas, if you're poor,
you don't have that luxury.
Okay, you can learn your first grader is going to learn to read over Zoom, I guess. I mean, if that's possible.
Yeah, if that's possible. And I want to be clear, and I'm sure you'll agree that. No one will fault someone for putting their kid in a pod. People will do anything for their kids, and that's to be expected and natural and good. The problem is that society has to help the kids that the parents are not positioned to help. I mean, that's the purpose of public schooling.
If you care about inequality, you should be at the front lines of wanting the schools open. I mean, that is absolutely the case. It helps the poor the most.
Yes.
And basically asking the poor to say, look, you send your kids to this online school, online only education. Okay, yeah, you don't have internet. I mean, I saw this picture in the San Jose Mercury News of 2 little kids, I think Hispanic kids, with their Google Chrome laptops.
Yeah, the Taco Bell. Yeah.
Yeah, because they had no internet access at home. They're sitting outside the Taco Bell with the internet access, and they're going to do school outside the Taco Bell on the street all year. That's 7 years old or 6 years. I mean, it's just not right.
I mean, I think that that is 100% not right. I think one of the missed opportunities, as I see it in the pandemic, is we can talk more about some of the maybe missteps we've made along the way. But I think one of the missed opportunities is this might have been an opportunity to try to create some sort of equitable distribution of the internet and things like that, and try to fix some of these sort of long-term infrastructure problems that some progressives have been beating on about, including myself, because I actually fall on the progressive side of the spectrum, which it makes it more interesting where I fall on the schools issue with the conservative side. Yeah.
These are not, I don't understand.
Yeah, why this became political.
Why is this political? Like, these are like fundamental values that everyone shares. Like, let's educate our kids. I don't think there's a single, I mean, maybe there's some crazy person, but I think that is something that unites the right and the left. At least my understanding it does. Let's treat people with human dignity. Let's account for all the costs and benefits of policies. Those are like not political questions. Those are just, I write with people I disagree with all the time.
Yes.
Politically, but we look at the data together and we decide, okay, but as far as like the values are concerned, what do we care about? Largely, I think the politics overblows them. Like, people care about the same kinds of things. We don't want to be poor. We want to be able to do our business. We want to be able to educate our kids. We want to keep ourselves safe from disease, not just one disease, but lots of diseases. We want healthcare when we get sick. All those things I think are the right and left share.
Let's talk about politics for a second. I think we do have to also acknowledge that, you're right. These sorts of values that you've espoused are values that everybody agrees with, we share. At the same time, we find ourselves in a unique situation in this country that's just so divided. I think it's a mistake to think that a lot of those divisions are policy issues. I'm not exactly convinced, and I'm not sure the data shows that people are always voting based with policy decision A, B, and C in mind. And the platforms of the two political parties are odd hodgepodges of policy mixes. They're not always sort of a rational policy bundle. A lot of people are also voting based on culture, and the culture of what the left is viewed as, which is sort of an apologist, shame on you, kind of we are better than you, holier than thou culture. I mean, that's how people view it. And the right as sort of a we don't care about, rough and tumble kind of. I mean, these kind of just really kind of branding that have kind of become synonymous with sort of the extreme political poles. But, we live in a time where people are very divided, and we have a leader who doesn't do a good job of bringing people together and has had so many things that perhaps unnecessarily inflammatory and have angered people. And so I guess I'm not surprised that there's a faction of people out there who hate this guy's guts. They don't like anything about him. If he says the sun rises in the east, they're going to say the sun rises in the west. That's the way it's gotten. But I guess it surprised me a little bit that academics couldn't sort of just take a step back and just say, I'm just going to ignore everything he says and come to my own conclusions on these issues. One of the things I found quite interesting was, when you early on in the pandemic, we're one of the first few people to just point out that there are serious downsides to the policy intervention as well. That was something that was a message that, many people felt was clearly similar to the message that I think Trump was offering. And therefore, I think the allegation was that you and John and others were sleeper agents for the right. And I thought, it's a long con that Jay Bott has been playing. 50 years he's been here, quiet, minding his own business, doing good policy, doing his economics work. And then 52, boom, he comes out. He's a sleeper agent for the right. That's why he's doing what he's saying. What do you think about this sort of worldview, that you are a sleeper, you're hiding sleeper cell?
I mean, look, I think there are real differences between the right and left. Absolutely. Like there's some things where right and left actually disagree.
Yeah.
I've spent my entire career at the intersection trying to bring data there was a debate. I learned one of the formative things I learned about that led me into economics was this debate between Paul Samuelson and Milton Friedman. Mm-hmm. Milton Friedman famously on the right and Paul famously on the left. And it was a polite disagreement. The issue was, do the right and left, do they differ because of differences in values, or do they differ because of differences in how they perceive facts about the way the world works?
Oh, interesting. Okay.
And Samuelson's point was, well, look, so obviously values differ, and that plays an important role. I think he's right. Absolutely, values do differ, and they sometimes lead to different differences in opinion. Not on the things I think we've talked about, like schooling for kids and things like that, but I think for a lot of things that's absolutely true. And Friedman's point is, well, look, what can we as economists, as scientists do other than to try to make a common base of data from which the right and left can sit and disagree? Then we know what if we've done our job, then we've done that the disagreements that are left really are values, and we couldn't have done much better than that.
Yes.
I mean, I spent my career trying to bring data to bear so that right and left, or whatever sides, can have a common place from to talk about policy disagreements, so that we can focus on the fundamental differences, not on does loneliness increase or decrease health spending? I mean, whatever it is, like
right.
Does increasing the number of years of residency, what does that do to how well we residents are trained, or whatever? I mean,
yes.
whatever the hours of work. I mean, it's just, these are like factual things that I've spent my career doing. I mean, I have political opinions just like anybody else, but I've tried very, very hard to keep them apart because I don't think they're all that interesting, frankly. Mm-hmm, mm-hmm. And to me, this from the beginning has never been a political question. This is just, let's look at the cost and benefit. And the policy itself, the lockdown policy is to me is almost the most, it's the most consequential policy decision in public health that I've ever seen.
I think it's going to shape the next 100 years. I mean, it's probably going to be the single greatest natural experiment or human-made experiment in our lives.
Yeah, and so we should treat it with the same way, with the same kind of framework we treat any other policy. Let's consider the costs and the benefits. And in the early days, it was in fact, I think to some extent still now, but
still
like
now,
less
yeah,
so.
I think so. Yeah.
People were only talking about the benefits.
Yes.
As if there was no other choice. The world was going to come to an end if we didn't do this, and where the data didn't support that.
Yes, I think
John came out early. John Ioannidis came out early on for just pointing that out. I mean, I had that sense early on as well. I think and this discussion about the cost was completely absent in a way that was frustrating to me, because there's a lot of these costs that you and I have talked about them that were foreseeable. And now that doesn't mean we shouldn't have done the lockdown at all. I mean, there was obviously a lot of uncertainty. I think reasonable people might have differed on that at the time. But at this point, I don't think it's reasonable anymore. I
guess
lockdown is not reasonable.
I guess
costs are overwhelming.
I guess, yeah. I mean, I think that that's the case. But I also, I mean, I think the calls to reinstitute a lockdown are there are people who say it. There are a lot of people who believe it, particularly the people on Twitter who have a certain view of this issue. But I think the real appetite for it is gone. I think, and I doubt it'll actually happen. And I think in the initial period, the one question I have about lockdown was, and we will learn this from, I think, some policy papers will tease this out, that lockdown struck different counties at different times, but cellular phone data may show that patterns of behavior changed in lockstep. So I'm actually not sure it did that much difference. It was the fear that may be a bigger driver. But, this will take years and years to sort of fully tease out what were the implications. But one thing go ahead.
Flipped, right? So like in February, there wasn't like this undue fear.
Yes.
The public health messaging was actually not unreasonable. Like there's this threat. Let's pay close attention to it. Let's sort of operate around it. But overnight, sometime in early March, the public health messaging turned into panic mode, and everybody panicked.
Yeah.
And then lockdowns followed one after the other shortly after that. I think that's going to require a lot of interesting, a lot of careful study. Like what led to that flip? It wasn't evidence.
It wasn't.
Yeah.
It was. I mean, I think one of the key events was the Imperial College model, which is now found to be a little off, a little inaccurate, but it was a key event because that model. I mean, it predicted
an IFR of 1%. Initial. I mean, just orders, like five times off.
Yeah, 5 times off. But it stoked a lot of fear, and it actually made it to the White House and influencing policy at the highest levels. One thing
all around the world. I mean, it's not just and
around the world.
Trump. Yeah. I mean, it's not just Trump, right? Everyone, countries around the world, I think, with the exception of Sweden, have responded with the same policy to certain, like, more greater or lesser degree.
Yeah, and I guess I'm glad Sweden didn't change, because the UK for a while they were resisting and they almost did something different. But the reason it's important to have some countries do something different is it'll allow us someday to figure out what actually worked and what didn't.
Yeah. I mean, I think that's going to take. I mean, I agree with you. This is something we're going to be studying for the rest of our lives in some sense. Like we just, and in fact, I'd say even stronger. Like I think if we're going to have a policy like this that gives public health authorities this kind of power, we need some checks and balances in place that require much better data and information in order to justify it before they're allowed to do it. Because the data in early March was not good enough to support this, and no consideration of costs at all. There needs to be in that discussion some consideration of cost and benefits, not just benefits of a policy of this consequence.
I mean, if you think about who are the driving sort of much of the discussion around COVID-19, I never would have guessed that it is a handful of people who are academics of different disciplines who are very, very active on Twitter. I mean, I think that the oversized role of social media in the pandemic will someday kind of play, it's not always the people who've been doing this for a living. It's some of the people who've had really big Twitter followings have reached the ear of reporters and they've sort of controlled, I think, a lot of the narrative around this topic.
Yeah, I mean, I don't do Twitter.
You don't do Twitter, so you don't see what I see.
But I do hear you. I mean, there's people will send me, sort of screenshots of people like stoking panic. I think
And the platform promotes fear. Like if you say fearful things, if you say shame on you, outrage things, those are things that the algorithms support. I mean, they drive those things.
Yeah, I think some mechanisms where we have a counterbalancing force that I mean, look, panic. I guess it's possible that panic could be the right response to some set of facts.
Yeah.
It's hard to imagine what those would be. Like, like we famously, the FDR says in the midst of probably the darkest time in the 20th century for the United States, we have nothing to fear but fear itself, right?
Yeah.
I mean, I think that kind of sort of like countervailing, like it's natural to panic in the face of bad news, really, really bad news. But like some sort of like countervailing messaging where, look, we shouldn't be panicked. We should think through this reasonably and and then take appropriate action based on what the data. That's always better. In my view.
Now, the one thing I wanted to mention or talk about real quick is, in John's commentary in mid-March in Stat, he speculated about a number of sort of low probability consequences of lockdown, and one he wrote was civil unrest and societal instability. I'm not sure if we've seen that yet, but we have had some, I think, increasing political tensions.
I read it consistent with John. I think it's frayed nerves, the lockdown frayed nerves, especially among younger people.
Yes.
And a lot of it's hard for me to see what's happened over the summer and the riots and the protests and the enormous civil unrest and not connected in some way to the fraying of connections between people. People were hungry for that, and of course it's the middle of it's over-identified because there's the middle of a very contentious election season, and there's all kinds of other things that might lead.
Yes, there's an election season.
George Floyd.
Yeah, there's a video of a police officer killing a guy begging for his life.
Yeah,
I mean,
but it's certainly over-identified. But I think it'd be hard to rule John out altogether. Like
yes.
that has played some role, and you're seeing this in lots of places. These sort of like frayed nerves spilling over into civil unrest. Lots and lots of places.
And I want to push on that a little bit more and say, when one reads history books, I've been reading a lot of history books about Europe in the 1920s. Some of the preconditions that allowed, I think, the worst of the dictators to take over, and the preconditions for World War II were you had a populace that was coming out of World War I, and they felt there was income inequality, there was a lot of restriction on jobs, and people in Germany, I think, didn't feel like they had a lot of outlets. You had sort of a charismatic demagogue leader come, blame somebody, scapegoat different racial and ethnic minorities. I guess one of my concerns is that we have yet to fully feel the brunt of all the income redistribution that's going to happen from COVID. The stage is set, I think, for the next decade that it's not going to be Trump. It might be somebody who has their act together a little bit more, somebody who is heart's in a darker place. But that kind of politician, not just in the United States, but globally, the stage is ripe for those types of politicians. What are your thoughts? I
mean, I was thinking about it more like pre-1914.
Okay, pre-World War I.
Civilization death wish. Okay, now I'm completely out of my league.
Sure.
But you brought me here, so,
yes.
So I'm blaming you. I remember reading about the history of the run up to World War I.
Yes.
I believe these great civilizations of Europe essentially tired. That's the thought has run through my head. A lot of this epidemic is we have this civilization that has brought 1 billion people out of poverty in the last 20 years, and somehow we just have decided it's not worth it anymore.
Oh, that's interesting.
We can give that up in order to address this disease. Okay, now I'm completely out of my depth. So, that thought has run through my head through this. Let me just end more optimistic on that. Then, I think that's up to us.
Yeah.
Right. And we should work our hardest to help that not happen. Both your vision and my dark vision. And I think, telling people, treating people humanely, thinking about treating people as if they have true individual dignity. All that, I think, unites us. I really do. I don't believe, my friends on the right, I don't believe want that dark vision. My friends on the left also don't want that dark vision. They want, what we want is to use the resources we have wisely, shepherd them so that even the least among us have opportunities. I think that vision can come true. We just need to make it real.
Yes, and that's a nice, I think, optimistic way to close. I guess maybe we'll just leave it there because I had a couple of things jotted down, but I think we've done a nice job. I think it's important to focus on the schools issue because I think the schools issue is the issue where we can, I think, potentially appeal to people who may be more locked in on other parts of this argument. But the schools, I think, is clear. The calculus tips, I think the way it tips in your mind, that's how I came to it. I mean, I started just reading a lot in all these buckets, putting papers in buckets. And that's how I felt like, well, that's my takeaway conclusion. It's a great error.
It's overwhelming, right? As soon as you start reading the papers, the published literature, it's not subtle. Yeah, they're all saying the same thing, and some of it's surprising, like the spread. But that one is an area where, like, I think a lot of people, it sort of unites generations. Like, parents want their kids to go to school. The kids actually, even if they may like summer vacation, but this extended thing is not good for them. They know it. Grandparents want their grandkids to be educated. I mean, I think this is one of these issues where the science and our desires line up, and we just have to overcome our fear. Yeah. And I guess maybe the last thing I'll mention real quick is, there are a lot of parallels and dissimilarities, I think, between SARS-CoV-2 and the 1957 flu. The ultimate IFR, I think, of the 57 flu came in between 0.2 and 0.3, but people reacted very differently. And if I think about it, it was just a different generation back then. The folks living through the 1957 flu had seen depression. They had seen World War. They were of a different mindset, I think. And the 1957 flu, in many books, it doesn't even exist. It's not even a noteworthy event. Do you think it's something about where we are as a culture that has changed since then? What is the difference? I mean, I think this actually, it could be an ironic outcome of the fact that life expectancies have gone up. Yes, that we were doing better. Yeah, an ironic outcome. So like we fear death more. Yeah. I mean, I think that if the initial reports were 3 or 4% case fatality rate, and people mistook that to mean that everyone that got infected is going to have a 3% chance of dying. But I mean, would I live my life completely the same with the 3% chance of dying if I get this? No, I would change some behavior. Would I want the civilization to shut down altogether? No, I would not. I would want some mechanism of continuing those things I value, and just extending my life and continuing my life is not the only value I have. Mm-hmm. And I think that's true for everybody. I don't think the mere fact of survival is not the only thing that we hold dear to us. Yes. As with 2 in 1,000, 3 in 1,000 overall, I guess it would depend partly on the distribution, right? So if it was young people that face that very high risk, I would be in favor. I have 3 kids. I'd be very, very strongly in favor of more restrictive, more active kinds of things. I have an 80-year-old mom. I think that the kind of restrictions I'm willing to put up with are very different if it's hitting the young more than. But at 2 to 3 in 1,000. Yeah, for the most part, we should figure out a way to live with it. Mm-hmm. And the fact that we know that it is this age that has such a big difference in age, well, that points to a good policy, like a policy that protects the vulnerable, the older people. We made huge mistakes with the nursing homes, not just us, the United States, but lots of other countries. I mean, by sending people back with positive test results to nursing homes that are chronically underfunded and don't have PPE and have circulating staff among nursing homes. That's like sending a missile in there. New York, but to be fair, like Sweden made a similar mistake. Yeah, they made a similar mistake. Yeah. Yeah. So I think it's not just, I think it's some such you can understand when we didn't have the information. Now we have this information. We kind of understand sort of what we have to do. Well, some people on the other side, they push back and they say, well, how are you going to protect the elderly only? And then I say, but your argument is that we all isolate. How are you going to do that? I mean, they both have a big how question component, but one acknowledges that the age gradient, one doesn't. Yeah. Yeah. Like, I think, you can't promise perfect safety to anybody. You can't, right? Exactly. But you can say what the costs are going to be. Like you're going to ask people to, in order to reduce community spread. I mean, that's really the thinking, right? So let's reduce community spread by what? By locking everybody in and paying enormous cost with a positive external benefit potentially. That's the argument, right?
Yes.
Well, the cost itself of the intervention is enormous for the person paying it, and the benefit is small because the community spread involves my interacting with my 80-year-old mom. Well, if I know she's at risk, I'm going to interact with her less.
Yes. Yes.
Right. And the economist logic, which is this. We need a Pigouvian tax to internalize the externality. Right. So the problem with that logic is the tax needs to be proportionate with the behavior you want to reduce.
Right.
If the tax is so large, well, you're going to go far out the other end of the social optimum. You're not going to get a social optimum. What you're going to get is a bunch of pissed off people who have paid a huge amount of cost, both in terms of their kids' education and their own livelihoods, with not much benefit to the community that they're trying to protect. Why not use our resources to protect that community?
Yes.
And think of creative ways to do that instead of this indirect policy that actually I don't think has worked.
Yes, I mean, I think that's a sensible thing, and I guess at a minimum, I hope that in the near future we will be able to at least sit down and have this discussion without claims of, I think, all sorts of ridiculous claims and smears and anger and vitriol. It used to be the case that academics could sit down and discuss these things, and we wouldn't always agree, even at the end of the day, but at least we could have that discussion. So, Dr. Bhattacharya, I'm grateful for you to come on the podcast and walk us through your thinking. I think it's very informative and very helpful.
Yeah, I really appreciate the opportunity, Vinay. It was nice to get to a chance to talk with you.
Yeah, thanks for coming. You've been listening to Season 3 of Plenary Session. Plenary Session is produced by Kiana Klossner. Music by Ian Straley and Audrey Tran. The views expressed on Plenary Session are those of whoever said it and no one else. Plenary Session is not medical advice. Follow us on Twitter at plenary_session. Until next time.